Good evening, everyone, and welcome to April's meeting of the Customer and Corporate Services and Scrutiny Management Committee. Before we begin, I would just like us to take a very brief moment to reflect on the many families up and down the country who have lost loved ones, both in recent days and over the course of this past strange year that we've had. Whoever you are, wherever you live, whatever you believe about life, the universe, and everything, to lose a loved one is never easy. And as representatives of the City of York, I think it's important that we acknowledge this, and I would just like us to have a moment's silence as a mark of respect and solidarity for all those feeling the pain of loss. Thank you very much. So on with the evening's business, I'd just like to remind you all that we are being webcast live and recorded for posterity. I know that most of us on this meeting are very familiar with the mechanics of these virtual meetings, but just for the benefit of anyone watching at home, I just want to briefly explain how the meeting will work. So participants have been asked to keep themselves on mute at all times unless invited to speak, and they can indicate their wish to speak by using the raise hand button within Zoom, which is visible to me as the chair, but not to people watching at home. I'll invite members to contribute in the order that I see their hands going up, unless I see members indicating to speak for the first time when others have asked several questions already. The exception to this is when participants are wishing to make a comment or ask a supplementary question that is pertinent to the specific issue being discussed, as opposed to starting a new line of questioning. In this instance, participants can draw my attention by physically raising a hand, and I'll bring them in if I can. Members of the committee will be joined on the screen throughout the meeting this evening by Janie Berry, who is the Council's Director of Governance and Monitoring Officer, and by Dawn Steele, who is the Head of Civic and Democratic Services. Off screen, there is a Democracy Officer who will be taking minutes, and we also have technical officers supporting us behind the scenes. Additional participants will be joining us at specific points throughout the meeting, so I'll be introducing them as and when they come into view. As usual, I'll be looking to take a short adjournment at an appropriate stage around the halfway mark of this evening's meeting, just to give everyone's eyes a rest. Before we head into the main agenda, I also just wanted to acknowledge some correspondence which I noticed in the local press following last month's meeting, and it's always very nice to be noticed, but I did note some misconceptions in one of the letters which I just wanted to clarify. The author suggested that some members of this committee had misunderstood their role as councillors on the Scrutiny Committee, and that that committee members' main role was only to ask questions of which they didn't already know the answer. They also went on to single out a committee member for having asked a question which they needed to be corrected on, having misread a financial table. Now, members of this committee will, I'm sure, be sick of me repeating the 4 tenets of good scrutiny, and will, of course, know that part of our role is to be a voice for members of the public. As such, we provide a function to articulate that voice and hopefully make the workings of the council clear, open, and transparent. And I think that's something worth just holding in mind when considering the questions we may wish to put to officers. We are here to put the questions that our residents may wish to see answered in a public forum, irrespective of whether or not we may know the answer already. So I'd just like to reassure all committee members that in my book, there is no such thing as a stupid question. Seeking clarification on something that doesn't quite look quite right is definitely something to be commended. And likewise, I'd hate to think that any members of this committee were not seeking to publicly elicit useful information for want of having had the privilege of private prior knowledge. And so on that note, I'll move us on to the main agenda, and I look forward to seeing lots and lots of blue hands going up for questions throughout this evening's meeting. So on to apologies. I've just received one apology for today's meeting. Councillor Pearson is being substituted by Councillor Wan. Councillor Wan, welcome back to the committee. On to the main agenda items. I have agenda item 1, which is declarations of interest. If anybody has anything they wish to declare, if you could just raise a hand, show me now. Not seeing anybody, so I can take us straight on to agenda item 2, which is the minutes. We have one set of minutes to approve from last month's meeting. I think that there's a typo just on minute 80, where it says the minutes resolved that the minutes of the last meeting of the committee held on the 8th of March 2021 were approved, but I think we're approving the minutes of the 8th of March meeting, so I think that should read the 8th of February. I didn't have anything else that I wanted to raise, but Councillor Kilbane, I can see your hand going up.
Thank you, Chair, and at the risk of asking a stupid question, on the minutes on page 4 of our packs, where we're going to receive a report on the potential for operating hybrid and remote meetings. This may come up during the body of this meeting, but I'm curious as to how the government edict about council meetings resuming in person will impact on that piece of work that we set for ourselves.
So I've discussed this with the monitoring officer earlier today. We're going to give you all a brief update of where things are as we understand them, and just prior to the meeting discussed, and I think I'll take that agenda item 4, which is around the COVID update. So just at the end of that section, I'll ask the monitoring officer to give us an update. The intention is still for us to bring a report to this committee next month, based on the most up-to-date information that we have, and just setting out what is and isn't possible. Obviously, it's a bit of a moving feast at the moment because there is a judicial review in place. But as I say, when we get to agenda item 4, we'll be able to give you a fuller update on that and take questions on that particular item. Other than that, though, is everybody happy that I sign these minutes as an accurate record? I'm seeing nods from everybody. That's fantastic. So next I can take us on to agenda item 3, which is public participation, and we have one person registered to speak this evening, which is Councillor Claire Douglas. So Councillor Douglas, I'm sure you'll be very familiar with the way that this works. You have 3 minutes to address members of the committee. I'll give you a nudge if you're getting to within 30 seconds of your time, but if you could just unmute, let us know that you can hear us okay, and then you can start as and when you wish to.
Yeah, I can hear you fine, Chair. Can you hear me?
Yeah, we can hear you loud and clear. So in your own time, you've got 3 minutes.
Thank you. Thanks, Chair. Agenda item 5 around procurement is a subject I've spoken to you about before back in 2019. The importance of both CYC as an anchor institution, that's big power and anchored to and in its community, and the impact of the council's procurement strategy and spending to the economic health of our city is undervalued. Officers in the procurement department has been communicating the virtues and importance of social value to CYC departments with buying power for many a year. The message still struggles to cut through and bring the level of investment to our city that is possible. As the report points out, the council spends approximately £170 million on goods and services per annum, with around 1,500 purchase orders per month. CYC uses an average of 2,270 suppliers during the year, and there are 417 officers across the council with delegated authority to make purchases. This is a lot of buying power with the potential to bring good quality, secure business opportunities to the firms, businesses and social enterprises of York. The government's current Green Paper is part of an ongoing review of UK procurement procedures and policies stimulated by the UK leaving the EU. It will potentially allow for a more localised and focused approach to the spending of CYC budgets. CYC must be ready to take advantage of the opportunities the potential changes will bring. In order to do this, we must understand where we are now. This could include a review of CYC procurement policies, identification of where and how social value procurement could be used more effectively, and thinking creatively about how the council's spending power and support as a partner in business can help the York economy to recover from the fallout of the COVID-19 pandemic. How it can help to increase good quality jobs in strategic industries, offer training and work opportunities to our young people and those looking for work, and reduce economic equality in our city. During many conversations I've had with officers, we've agreed it's no small task to truly embed social value into procurement across CYC, but it's a huge missed opportunity if we don't. If we want to see CYC fully take on its potential as an anchor institution in our city and region, a fresh look is required at the importance we, as councillors, give to CYC procurement as a positive force for change and development in our city. The role of CYC procurement in delivering the city's economic, inclusive growth and skills and employment strategies is integral, shouldn't be underplayed and can't be ignored. I ask you to take on the task of a detailed scrutiny topic to understand how CYC's spending power can be reshaped to provide a very real boost to our city's economy, health and well-being. And now is the time to do this. Thank you, Chair.
Thank you very much, Councillor Douglas. I'm sure that all those points that you raised there will be noted, and when we get to agenda item 5, we do have some considerations to make in terms of what our next steps might wish to be. So I'm sure that people will reflect on them at that point too.
Thank you.
So if I can now move us on to agenda item 4, which is the public health update on COVID-19, and welcome Sharon Stoltz to the screen. Sharon is the Director of Public Health and supplied us with a presentation a bit earlier today, which I think you're going to take us through now. And once you've done so, then I'll invite members to ask any questions that they may have.
Thank you, Chair. I'm hoping that somebody from the technical support is going to get the presentation up on screen for us. Yeah, that's lovely. Thank you. So can we go on to the next slide, please? So this is the most recent data. You've seen this graph before. York is the red line there. So York has had a total of 12,159 cases of COVID since the start of the pandemic, which gives us an overall rate of 5,773 per 100,000 population. That sounds a lot, but it is lower than national and regional averages. And as you can see in this slide, which presents the data for the last 7 days, you can actually see how the picture of the pandemic in York varies compared to England and the Yorkshire and Humber regional average. Even though we've had 3 peaks, the last one being the largest, our case rate has come right down, and we've been able to sustain that low rate for a number of weeks now, which today stands at a rate of 9 per 100,000. When we look at where York stands compared to other English authorities, we're actually the 6th lowest local authority in England for cases at the moment, which presents a very positive picture for us in York. On to the next slide, please. This shows where we are in terms of our positivity rate. So one of the reasons why we are doing testing at the moment, and why we have a testing strategy around symptom-free testing, is that testing regularly is key to the country successfully emerging from lockdown. As the roadmap continues beyond the 21st of June, there will be a review of social distancing before then. There will be a review of the wearing of face coverings. We're hoping to get life back to normal again. But it's important that we still are able to identify any positive cases of COVID. Coronavirus isn't going to go away. It's going to circulate still at low levels throughout the summer. So it's really important that people start to view being tested twice a week as a routine thing that will help us to control the pandemic going forward. So at the moment we have 4 symptom-free testing sites across the city. The Foxwood testing site opened last week, and we still have the 2 testing sites for people with symptoms, which is the university testing site at Wentworth Way and the drive-through site at Poppleton Bar. So our local testing sites for symptom-free testing, you shouldn't go to those sites if you have symptoms. We're also moving to a community collect model of tests so that people can collect a supply of tests from one of our testing sites, and they can do their tests at home and upload the results if that's easier for them. And as you can see from this slide, we're actually picking up lower numbers of positive tests in York at the moment, which is great news, and it just reflects where we are in terms of our case numbers. Going on to the next slide, then this shows where we are in terms of the Yorkshire and Humber region. York, for most of the time we've been reviewing this data, has had the lowest rate of COVID. We had a couple of weeks in January, early February, when we had the highest rate, but it's great that we're back down there with the lowest rate at the moment. On to the next slide, please. This shows rates by ward. Again, a very positive picture. You can see that there are a significant number of wards that have had no COVID cases at all in the 7 days. And even those wards with higher rates, when you look at the actual numbers, they're still quite small. But we continue to review this data on a regular basis so that we're able to pick up any clusters of cases. On to the next slide, please. So for a number of weeks now, we've had no care homes with cases of COVID in York. The last outbreak being on the 25th of February there. So a very positive picture with care homes. And again, amongst school-age children, we've just seen 7 children of primary and secondary school age who've tested positive. Obviously, schools have been on holiday, so that will have had some impact on those numbers. But what we've seen with children is, even though there was an initial spike in cases, which was expected when all children returned to school, that very quickly dropped. And we're not seeing high numbers of children with cases at all, which has been the picture more or less in our schools throughout the pandemic. On to the next slide, please. This again shows a very positive picture in terms of hospital admissions. Just 6 people in hospital and 1 in intensive care, the most recent hospital data up to the 8th of April. So again, a very positive picture there. And then going on to the next one, which shows deaths. So I'll just explain a little bit about this, this graph. So since the start of the pandemic, we've had 386 COVID deaths recorded for CYC residents. That takes us up to the most recent period, which is the 19th of March. Just 2 COVID deaths in the last week. So though that number of deaths has fallen and is now very low. The average age of COVID-related deaths we're seeing in York is just over 82 years, with an age span of 44 to 104 years, which compares very favourably with other areas. But what we are recording is what we call excess deaths. We know that there can sometimes be accuracy issues with the way COVID deaths are recorded. So we're also looking at excess deaths. So what you can see is that since the start of the pandemic, we've had 181 excess deaths in York. But as you can see from that blue line there, that hasn't been constant throughout the year. And so there have been periods, including where we are now, where we're actually seeing week by week lower than the expected deaths. But this is because, as you can see from the graph, we've had peaks where we've seen more deaths in some weeks than others. So that's just to explain that graph in a little bit more detail. On to the next slide, please, which really says something about how successful our local contact tracing service has been. So for a number of weeks now, we've been doing all contact tracing in York, what's called COVID-O, which means that we take over contact tracing as soon as positive cases are uploaded onto the national system. And as you can see there, we continue to maintain a very high success rate there. Around 100% of our cases of COVID in York at the moment are down to the Kent variant. But we have had 2 cases of so-called variants of concern in York over just before and during the Easter bank holiday. Both of those were linked to travel, both very well controlled. We didn't need to do any enhanced contact tracing as a result of those concerns. One was the South African variant, and another one was a different variant of concern. We do have comprehensive surge testing plans in place so that if we do have a variant of concern and we do need to do enhanced testing or contact tracing, then we have the plans to do that. But I'm very pleased we didn't need to test them over the Easter bank holiday weekend, which is a huge relief to me. So going on to the next slide, then I wanted to say something about where we are with COVID vaccination, and I'm sure there'll be some questions about this as well. So just a reminder of what the COVID vaccination programme is about. It's to protect those at highest risk from serious illness or death, and the schedule for inviting people for their COVID vaccination is determined by the National Joint Committee for Vaccination and Immunisation, and that includes the clinically extremely vulnerable groups as well. So there's been lots of discussion about different key workers and whether they should have priority for vaccination. But this is the criteria which the JCVI uses. It's not about exposure to risk. It's really about protecting those at highest risk from serious illness or death. So I've got a couple of slides showing data for you. So as we know, the Pfizer, which I don't think is spelled correctly there, and the AstraZeneca and the Moderna vaccines are the 3 vaccines that have been approved for use in the UK. The York Vaccination Centre will be starting to use Moderna from this week. So we'll have access to the Pfizer, AstraZeneca and Moderna vaccines in York. So just some overall figures before I go into some of the detail of the slide. So as at the 11th of April, just over 93,000 York residents have had their first dose of COVID vaccine, which equates to 53.6% of the estimated adult population in York. It will be higher than that today, but these are the most recent figures I've got for the 11th. And then just over 12% of the adult population have had 2 doses of the vaccine. And the priority at the moment for the vaccination programme is to ensure that everyone in York is offered the first dose, and that then really prioritising the uptake of second doses as well. So what this slide shows, if you can see it okay, is the vaccine uptake by categories. So we've got age groups there, the percentage that are being vaccinated in clinically extremely vulnerable groups, NHS and social care workers, carers, etc. And as you can see, if we look at the blue line for people receiving their first dose, we've done incredibly well in York. But as you work down the age groups, what we can see is that the uptake, percentage uptake starts to reduce. So very high uptake, over 90%. When you look at the older age groups and clinically extremely vulnerable. But as we go down the age groups, particularly once we get into carers, and we start to look at some of the other groups, the uptake isn't so high. Now, there are 2 reasons for that. One is that obviously the 80 plus age group was offered vaccination, were first to be offered, as were health and social care workers, and the over 50s and carers have groups that have been invited later on. But if we want to achieve over 95% uptake, which is really what I'm aiming for, you can see that there is some additional work to do there. So we continue to monitor this vaccination uptake very closely with GP practices and with the CCG in York, and we'll be continuing to monitor these vaccination rates over the next weeks. Going on to the next slide then, because we've got, what we've done here is really focused on the over 50 age group, which is what we've got most data for, to try and have a deep dive into what's happening with vaccine uptake with this group. And as you can see, we have a considerably higher uptake for women than men. Now, part of this might be explained with the fact that female life expectancy is higher than male life expectancy in York. And so we might expect there to be a difference, but this is quite a large difference. So one of the areas we're looking at the moment is uptake of vaccination across all ages by gender. And then on to the next slide, we're also looking at it by ethnicity. So again, when we look at the ethnic breakdown in York, we know that white British are our largest ethnic group in York. But it's really interesting as well to look at the variation in uptake from the different ethnic groups. And as we can see there, it's people who fall into those Black and ethnic minority groups that we are seeing lower uptake and starting to get a picture of those particular ethnic groups that we need to be prioritising. On to the next slide then, please. Hopefully you can see this. So this breaks down the ethnic categories and description and descriptions further. So as we can see, if you look at all York residents over 50, we've got an overall vaccination rate of first doses of 92%. And we've got an uptake of 95% when we look at white British. But then you can see the variation emerging for the different ethnic groups. So we can use this data to start to have conversations about how we target our vaccination work to these particular sections of our community. It's important to point out that COVID vaccination is voluntary, but it is absolutely crucial that everybody receives the right information so that they're able to make an informed choice about whether they wish to be vaccinated. And then obviously we need to look at any practical barriers to vaccination, which I'll come on to in a moment. We also then, going on to the next slide, look at vaccination by wards across the city. And again, we can see variation here. We've got over 90% uptake until we get to Copmanthorpe, which is just below 90%. But then when we get into Middlegate, Fishergate, Clifton, Guildhall, that rate starts to fall, and we have Guildhall with the lowest uptake at 76.9 there. So we examine this vaccination data to look at variation by age, by where they live in the city, and by ethnicity as well. So going on to the next slide, I just want to talk about some of the work that we've been doing to identify some of the barriers to access. So these are some of the early indications from the work that we've been doing. And there won't be any surprises to anyone, I think, about some of these barriers. So transport is an issue. You know, you have to be able to get to the vaccination site. And if you haven't got transport, then that can be challenging for people. As we get into the younger age groups, there's also an issue of whether people have childcare. So you may not want to take your child with you to the vaccination site. So access to childcare to enable you to be vaccinated, even if you can get to the vaccination site, is an issue that has been identified. The vaccination site location. Is it an easy location for people to be able to get to and to navigate once they get there? We have got home vaccination available, but we have to be able to identify those people that need vaccination at home. And so I'll explain in a little while some of the work that we're doing around that. For some people that have been we've spoken to as part of this work, if they've been shielding for the biggest part of the last year, if they've been in that clinically extremely vulnerable group or in the older age groups, and they've been shielding, it can actually feel quite frightening going out if you've not really been outside your house for that time. And then obviously there's vaccine hesitancy, whether that's because of poor information, what they've read or heard about. So myth busting and giving people accurate information is part of the work that we've been doing. And then there's quite a big cohort of people who think that it's too late. They didn't respond when they got their invitation to go for vaccination, and so they think it's too late and they've missed their chance, which is categorically not true. We want 100% of people, if possible, to take up vaccination. So even if you didn't respond to your invitation, it's still possible to book yourself on and be vaccinated. So going on to the next slide, to talk about some of the work that we're doing. So this is one of the pilots we're doing at the moment with GP practices. So we have a local contact tracing team, as you know, highly skilled team now, very used to talking with people, are used to having sensitive, confidential conversations with people. So our contact tracing team are being vaccine trained, not to give vaccinations, but to be able to help people to get the right information about vaccination, and for them to talk through any concerns that they may have about that. And that data is being shared between GP practices and the contact tracing team. So GP practices are identifying their patients who haven't presented for vaccination yet, and then our contact tracers are contacting them to have that conversation. And then GP practices, we're sharing this data with them. They're also looking back at their medical records of people that have been invited for vaccination, why they haven't been invited, looking to see whether they fall into one of these groups that we've identified, and then looking at ways of getting in touch with those individuals, and again addressing any concerns that they might have. And then I think this is the last but one slide. Oh no, it is the last slide. And then something about the partnership working that we're doing. So the delivery of the vaccination programme is the responsibility of GP practices. Community pharmacists will be coming on stream as well. But as a council, as a local authority, and myself as Director of Public Health, also have a responsibility to ensure that there's an effective vaccination programme in place. Obviously, we can't do that on our own as a council, so we're working very closely in partnership with the Vale of York CCG, with Nimbus Care, who, as you know, is the group of GP practices that have come together to deliver the vaccination programme. We're speaking to community leaders to understand people's issues. The more people that we talk with, we're also getting insights into the support that people need. We've established a City of York vaccination inequalities group that's public health led, which also links into North Yorkshire and the Humber Coast and Vale vaccination group as well, so that we can share any learning on that wider footprint as well. So I'll stop there if that's okay, Chair, but I'm happy to take any questions.
Thank you very much, Sharon. That was very comprehensive and very helpful. Thank you. I'm just looking at hands that are flying up, which is great. I just want to commend you and your team, and also the residents of York, though, because I think that the rates of infection and being the 6th lowest in the country is absolutely fantastic and testament to everybody's hard work. And I'm sure you would want to encourage everyone to keep on going, because I think the temptation as things ease is to rush ahead. But no, it's fantastic to see the rates as low as they are. So a big long list of names. I'm just going to take them in the order that they hands went up, and first up was Councillor Rowley.
Thank you, Chair. And Sharon, again, thank you so much for what you and your team are doing. It's been a really, really challenging year for you, and hopefully we are seeing the back end of that, although I recognise that your work will continue well past June the 21st and probably into next year as well. I have a couple of questions really, and I'll ask them both together, then I'm kind of done really. The first one is with regards to the 7-day positive rate chart that you gave to us. You mentioned there about the lateral flow tests, and the 7-day lateral flow test was 0.04, where the national average was 0.1 and 0.2. I'm just curious, if somebody has a lateral flow test that does test positive, the requirement is that they then need to go and have a test at one of the centres. Is that correct?
Yeah.
Yeah. Are we finding then that where someone has a lateral flow test that's positive, generally is that being confirmed by the second test, or I'm just trying to find out the accuracy of the lateral flow tests, because it'd be good to know that they are relatively accurate, and that those readings are coming through and being repeated and confirmed in the second tests. That's my first question. My second question, and I'll let you answer both, then I'll go on mute, is to do with the fact that obviously we are coming out of lockdown. And again, really commend you and your team and the wider team in York on the vaccine programme. I was fortunate enough to have the first vaccine as a key worker back in January, and the second vaccine at the beginning of March. So I'm really pleased with the team and how they've worked. And I commend you and the workers for that. Clearly, when we come out of lockdown, you mentioned that COVID won't go away, that it will lay low. But as we relax lockdown, and we've seen it today, people will naturally forget about the social distancing, all the measures that we have in place to prevent the spread of COVID. My understanding was that clearly the reason for the restrictions has more to do with protecting the NHS and ensuring that those vulnerable people who have now been vaccinated don't end up in hospital and in intensive care and putting pressure on the NHS. Is there an expectation that the rate will go up, but actually the bit that we need to concentrate on is more those that are in hospital rather than the rate? Because we're going to expect the rate to go up, but it's the NHS and the hospital numbers that we need to keep an eye on. And I'll mute on that. Thank you, Sharon.
Okay, so on the first question, it's a very interesting question and a good question, Councillor Rowling. So what I know is that there are 69 people in York who tested positive on a lateral flow test, who subsequently tested negative with a PCR test. But that is only 69 out of the thousands and thousands and thousands of lateral flow tests we've done since December. And that is all of the testing we're doing with lateral flow. Hospital staff are being tested twice a week with lateral flow. Care home staff are being tested. Key workers are being tested, as well as our lateral flow testing, our council-led community testing programs as well. So we're doing some backward tracing at the moment to try and see whether we can get more granular data from Public Health England to tell us where those false positives have come from. Because it's more dangerous if it's in a care home than if it's amongst the general public, for example. So I am confident that all of the work that the quality assurance work that we've done in York to train people around taking lateral flow swabs and the quality control measures that we've got in place are working well. If we've only had 69 false positives. But we're not resting on our laurels, and we are digging into that to see whether we can get that number down even further. Because ideally, we'd like to be in a position where we don't have any false positives at all. Although as people doing more and more home testing, we lose some of our quality assurance as more people get tested at home. So that's a bit of a challenge for us. In terms of your second question, you're absolutely right that rates are low at the moment, and that one of the primary reasons for lockdown was to protect the NHS and to prevent avoidable deaths. And those were the main reasons for lockdown. One of the challenges we've got as we come out of lockdown and start to get to some kind of normality again is there are these variants of concern floating about. And we're still learning about some of these variants of concern. So you'll have heard of the South African variant, you'll have heard of the Brazilian variant. We know we've got the Kent variant in York, and that was one of the reasons why we got this massive spike in cases around Christmas and New Year. And so not everyone will be vaccinated, because some people will choose not to be vaccinated. So we don't know whether we'll get to the level of herd immunity. We don't fully understand yet how effective the vaccine will be against any of these new variants of concern that might end up floating about. And because the government are reviewing social distancing guidance and they're reviewing the wearing of face coverings, because ideally we'd all like to get to a position where we didn't need to worry about social distancing and face coverings. The government is doing a number of pilots at the moment to look at what the impacts are of having large crowds of people without social distancing and without face coverings. So you will have heard about some of the pilots that are national pilots that are taking place. And so testing becomes a really important tool in our ability to be able to control this pandemic. Vaccination on its own won't do it. So we need vaccination and we need testing. And if everyone engages with the testing program fully and gets tested twice a week routinely, which is what we're asking people to do, then we'll pick up positive cases and we can do contact tracing and isolate any positive cases really, really quickly. And if we do that, we don't need the social distancing and we don't need the face coverings. So vaccination, testing and contact tracing will become our greatest tools to getting back to normal, but still controlling the pandemic, because it isn't going to go away. And we're expecting there to be a booster vaccination program in the autumn that will be more resilient against any of the variants of concern that we know are already circulating at low levels in the UK at the moment. So does that help answer your question? Yeah.
Thanks, Sharon. Next is Councillor Hollier.
Thanks, Chair. I've also got a couple of questions, if that's okay. Firstly, just in terms of slide 5 and the sort of overall rates, how would you account, I guess, for the sort of relative performance of York compared to the rest of York, sort of North Yorkshire, and sort of the wider region generally? I guess it's sort of, you know, what are we doing that other places aren't, or what sort of natural advantages do we have that they don't? And then if I could come back to my second question after that, perhaps.
Okay, yeah, that's fine. So we're brilliant in York, aren't we? So I think that's one of the reasons, you know, our city response to the pandemic has been incredible. You know, whether we talk about the wider council services, whether we talk about residents, you know, the NHS, care homes, everybody across York has been brilliant. And that has helped to keep our case numbers down. We also reacted quite quickly to get our own local testing and contact tracing in place, which we know has been very successful. So that will also have helped us as well. But we also need to think about some of our demographic factors, some of the advantages in York that other parts of the region don't have. So, you know, we have had a lot of staff furloughed who would have been working in retail and hospitality, whereas in other parts of Yorkshire, they've had a different economy. And they've had more key workers that have had to go out to work, who've been unable to work at home and haven't been furloughed. And so therefore they've had greater exposure to the vaccine, to the virus, I mean. And also we need to think about people's general health. So the health of our residents in York is generally better than some other parts of the region. Obviously, we do have people in poor health, but when you look at our population as a whole, we have higher levels of people with self-declared good or very good health in York. So we haven't got the same levels of chronic underlying disease as some other parts of Yorkshire, particularly West and South Yorkshire. And so when you look at all of those factors together, they will all have had an impact on our case rates being so low. So it's not that we're doing anything differently to other areas. I think we responded more quickly than some areas to have some local measures in place. But our population undoubtedly has had an impact as well.
Thank you, that's really helpful. I'm sure it's also due in no small part to you and your team, so just a general thanks as well. Just had a few more specific questions on slide 12. I don't know if it's possible to get it up again, because it might just help, but I have got notes to, so it's not possible to just bring it back up again quickly.
Which slide was that? I didn't number them. That was not very helpful for me, was it?
The vaccine uptake by category.
Ah, right, okay.
Yes, so my first sort of mini question on this was just whether there was an idea of how many people had been offered the second vaccine by category, because obviously, I guess it's a bit difficult to gauge whether 49% is good unless we know that, you know, either 60% have been offered or 100% have been offered.
Yeah. So when we're looking at the inequalities, we're focusing on first doses at the moment, for the very reasons that, you know, you're highlighting really. Second, there's been, you know, second doses are only just beginning to be rolled out. All care homes have been offered their second dose vaccinations at the moment, and then it's being rolled out to other areas. So we'll be keeping a close eye on this, but our priority at the moment is making sure that 100% of people are offered the first vaccine, and that they have to positively decline it, if you see what I mean. So they don't not have it by default because we failed to do something. They only don't get their first vaccine if they've actually, intentionally declined it. If we get the first vaccination right, then the second doses should follow. But the same process of examining second dose uptake, looking at those same practical barriers that we looked at in one of the slides, we'll be looking at all of that for second doses as well. But the reason for the variation of second doses at the moment is because they've really only just started being rolled out.
In terms of the 50 to 54 group, 4% have had a second dose. Are they a separate group to the clinically extremely vulnerable? Are they sort of mutually exclusive groups, or are they 4% because some of those are
yeah, so there is a little bit of double counting in this slide. So if you're a carer, and you also fall into that 55 to 59 age group, there is a possibility that you might be counted twice. We're looking at how we can get better at collecting this so that this doesn't happen. But this isn't data. This vaccination data is national data. So it doesn't give us much flexibility to cut it differently locally. But similarly, if you fall into the NHS and social care worker category, there is a possibility that you might be double counted in one of the age categories as well. Is why when you look at some data, we've got more than 100%. And it's simply because of that little bit of double counting that's happening at the moment.
Just on that, Sharon, just 1 second, Councillor Holly, I'll just jump in because I think it's an interesting line of questioning. The 70 to 74 and the 65 to 69 second dosages seem to be lower than almost all of the other second dosages, with some quite younger people. Is that possibly that double counting as well, or is it just that the numbers are so low that it's not statistically that significant at the moment?
It's just to do with there are a couple of things that impact on it. There's the issue of double counting, as we've already discussed, but there's also the time scale for people being invited. So over 80s and NHS and social care workers were the first cohort to be invited. So you would expect there to be a higher uptake because they're having their second doses now, which is what Councillor Rowley reflected on. He's counted in that NHS and care worker category, so has already had his second dose. The second dose vaccination data will become more meaningful over the next few weeks as more people start to be invited for their second dose, and we'll start to pick up any vaccine hesitancy there might be around second doses because of concerns around the AstraZeneca vaccination, for example.
Thanks, Sharon. Councillor Holly, did you have another question before I bring anybody else in?
Yeah, sorry, just very quickly.
Yeah, sure.
By definition, I guess, eventually the second doses will be a certain percentage lower than the first doses. I guess, is there any overall concern if your target is 95%? Is that of everybody getting 2 doses, or is it not such a massive concern if sort of 96% get the first and 85% get the second, or 90?
For us to be confident of the best efficacy for the vaccine, people need to have 2 doses. This data will not be static because people will come in and out of these category groups. And also, some people in the 80+ age group will die between their first and their second dose. So the numbers are never going to completely add up. But what the the richness of the data, I think, the data we're now starting to get, is helping us to have the best understanding of uptake in different age groups, and the extra work that we have to do to get in touch with people, to talk to them, the practical things around, you know, people want to be able to have a vaccine closer to home, and so feeding all of this information into Nimbus Care and the CCG, so that they are looking at where they've got their vaccination centres at the moment, is also how this data is being used. So it's like all data has its limitations, but it's using the data to tell the story that we need to improve services to residents and improve outcomes to residents is really what we're using this for at the moment.
Thanks, Sharon. I will now bring in Councillor Hunter.
Thank you, Chair. I actually found this totally fascinating, and particularly that last slide, because I actually fall into one of the categories, the 65, so my second dose isn't due until May, so I can see that chart changing. I've just got one question, and you touched actually on it when you were answering to Councillor Rowley. My question is there a further plan to expand testing, the testing capacity in the city?
Oh, that's a tricky question, because
Sorry.
some of it depends on government funding. So there are two pots of money that we use for, well, I use this. There are other pots of money that, you know, other services across the council have got, but my pot of money is the COVID Outbreak Containment Fund, which funds things like COVID marshals. It funds our communications, our signage across the city for COVID, and it also funds our contact tracers and additional environmental health officers, for example. And then there's the testing money that comes down directly from Department of Health and Social Care. So I have to submit a testing strategy, and then the government approves it, and then I get the money. Now, the money for testing has only been approved until the 30th of June. The government hasn't made it clear yet what funding is going to be available to local authorities from July onwards. And so what we're looking at the moment is a testing strategy that is as flexible as possible, to be able to ensure that everyone in the city continues to have access to rapid testing through lateral flow twice a week. And then working with Department of Health and Social Care around that, and hoping for the best in terms of funding. So provided the funding's there, we've got 4 testing sites, symptom-free testing sites at the moment. It's Foxwood, York St John University, the university site, and the stadium. We're also working in partnership with a designer outlet. So there's going to be a testing facility there for staff, and all of the staff working on that site to be able to access testing. And, you know, ideally, we would like to be able to roll that out further, but ask me in June, when hopefully I'll have a little bit more information about the funding available. I mean, any lobbying that anybody would like to do of central government to carry on the funding for testing would be very welcome.
Councillor Fenton, I think you had a supplementary there.
Yeah, thank you, Chair. Just, I suppose, just to flag up to Sharon that I know with the testing site opening up in the west of York, I've already had a couple of calls from people asking if, what proof will they get if they have a test and it's negative. I can only imagine they're thinking ahead to overseas holidays, which we've been told not to think about. But so I suppose just to flag up that, as well as accessing the testing facilities, then the team may start to get requests for, can I have a certificate? But just to make you aware.
Yeah, at the moment, COVID certificates are not part of our strategy. It depends on what government announces in relation to that. At the moment, the proof that people get if they have a mobile phone is they have a text confirming that their test is negative. If they don't have a mobile phone, then there's a paper equivalent that we can give to people, but we won't be issuing certificates, and neither will GP practices. So I don't know what the government is going to do around that, because local authorities and GP practices will not have the capacity to issue COVID certificates. So we'll just have to wait and see what the government's plans are, I think, in relation to that. But I'm ahead of you, Councillor Fenton, and we've already identified it as a potential risk given the cost of private COVID tests.
Thanks, Sharon.
Plus, they can pay us to take a test. That maybe that's an option.
I've just got a couple more people waiting, and then I'm going to start to draw this section to a close now. So, Councillor Mason.
Thank you. Obviously, we had the kind of peer review. I just wondered what we've learned from that, really, and if there's anything kind of really pertinent to improve on or to develop.
Right, another good question, and my apologies, Chair. I should really have sent the COVID Peer Challenge feedback report to Scrutiny members, but I'm happy to do that following the meeting. The feedback was extremely positive. They highlighted lots of evidence of best practice in York across all of our partners. They particularly praised our approach to communications and engagement, our partnership working across the city. They interviewed over 40 people as part of that. So it's a wide-ranging peer challenge. They talked to a number of different people. The only areas, the recommendations really weren't for improvements. There were recommendations for us to consider around our aspirations. So what are our aspirations as a council and as a city as we start to come out of COVID, and how we articulate that, how we plan for worst case scenarios. We hope that York will continue to have low rates, but if we were to have an outbreak of one of the variants of concern that led us to put in place local lockdowns, are we prepared for that? Something about staff well-being and resilience. All staff, never mind which organisation you work in, but particularly probably health and social care, are very tired after a year of doing this. Although I would argue we're all tired. We're all tired even on a personal level, let alone a professional level. And so a focus on the mental health and well-being of the workforce and as the city as we come out of COVID. But really to celebrate and to continue to build on the successes that we've had. So they didn't identify any areas of concern.
Councillor Rowley, is that supplementary? Yeah.
It is, Sharon. Thank you for allowing me. Sharon, just you touched there on the fatigue of the workforce that we have. Those members of staff that are on temporary contracts, can I assume that they are being afforded the same rights in terms of leave and sick pay and support as permanent members of staff?
Yeah. So they have access to exactly the same support as full-time council staff have, as do Work with York staff, where they Work with York staff and other temporary staff have played a key role throughout the pandemic. We couldn't have run our testing and contact tracing service without them, and they continue to do an excellent job. So yes, I can reassure you on that issue.
Thanks, Sharon. So last question to Councillor Kilbane.
Thanks, Chair, and thanks, Sharon, and thanks for all the work you're doing and have been doing now for over a year. How the world has changed. In terms of people who are vaccine reluctant, if the reason for the reluctance is concerns around the AstraZeneca vaccine, will they be offered the Moderna or Pfizer instead?
It depends on why they're reluctant. If they're reluctant because they are frightened of having the AstraZeneca vaccine because of what they've heard, but they are not at risk from the AstraZeneca vaccine, and there is a face-to-face conversation with them around that, we're finding that the vast majority of people are then happy to have the AstraZeneca vaccine when the risks are explained to them. But if there was refusal, if we couldn't convince them that the AstraZeneca vaccine was safe and there was a vaccine refusal, then that decision lies with the with Nimbus Care and the vaccinator as to whether they would be offered an alternative. And some of that might just be down to supplies of the alternative vaccines, which would be Pfizer and Moderna. So if somebody refused to have AstraZeneca, and that was their choice, we couldn't convince them otherwise, they may not be able to be vaccinated that day. They might have to wait until there are further supplies of Moderna available, for example. So it's hard to give you a straight answer to that one, Councillor Kilbane. It really depends on the individual circumstances, and it'll be different from individual to individual. Obviously, people under 30 will not be offered the AstraZeneca. They will be offered either Pfizer or Moderna as a matter of course.
Thanks, Sharon. Go on, Councillor Rowley. I'll let you have one last supplementary, and then we'll draw this to a close.
I will be leaving the meeting early, so hopefully I get all my questions in now. Sharon, it is a serious question, following on from Councillor Kilbane's excellent question there. So somebody who has previously had the AstraZeneca first jab decides, by all the advice given, that they wish to have an alternative. So the second jab they get, would that be classed as a first dose of that new vaccine and therefore would require a third, or would that be a sufficient?
So at the moment, the advice is that we can't mix vaccines. So if somebody has had a first dose of AstraZeneca and they've been absolutely fine, there is no reason for them not to have a second dose of AstraZeneca. And in that situation, I'm not sure what would happen, to be honest. I think at the moment they would be offered AstraZeneca. And until the national guidance changes around the safety of mixing vaccines. I think it unlikely that they would be offered the choice of a different vaccine. Just quickly, Chair, if I may, the risk to the AstraZeneca vaccine is minuscule. It is really nothing for people to be concerned about. The risk is similar to, and I'm trying to think what I can compare it to. So if you're in a long haul flight to Australia, the risk of getting a clot in your leg from a long haul flight to Australia, you're talking about that level of minuscule risk with the AstraZeneca vaccine. So I would advise people that if they've got any concerns about the AstraZeneca, that they turn up for their vaccine appointment and they have that discussion with the vaccinator, who can go through the detail of their individual circumstances and hopefully reassure them as to their level of risk. There is guidance that health professionals have been given about the AstraZeneca vaccine, and we wouldn't offer it to anyone unless we felt it was safe for them to have it. So it's really about trying to put those risks in context. They really are minimal.
Thanks, Sharon, and I think that's a really, really important final point to make there. What I'm going to just ask you to do, if you don't mind, Sharon, is just hang on the call. I think that's essentially your item finished, but we just wanted to briefly update members on remote meetings under this item. I don't think anything will come up that you'll need to be there to answer, but since we've got you here, if you don't mind just hanging on for an extra 5 minutes. And what I just wanted to do was myself and Janie, the monitoring officer, had a little bit of a conversation this afternoon, because it occurred to me as I was preparing for this meeting that with the government having not extended the legislation around remote working, the next meeting of this committee falls after the 7th of May, when there's no provision for remote meetings to be held. But my understanding is that there are some complications around being able to deliver meetings because of the social distancing guidelines that will still be in place following the 7th of May. So I think if Janie, if you're happy just to give us a quick sort of 5-minute précis of where we are at the moment, and I understand there are quite a number of unknowns within it. So if you could just give us a very brief update, and then if members do have any urgent questions you want to ask on it, feel free to, but I think it is a bit of an evolving piece at the moment.
Thank you, Chair. Yes, it is an evolving piece. At the moment, as I sit here today, I can't give you any great clarity about the steps to be taken, save that the government's proposal is that, yes, we do return to physical face-to-face meetings from 7th of May. However, that is subject to adherence to quite detailed guidance from them around building safety. So the building where we need to host the physical meeting has to have a robust risk assessment, and also take into account advice from Sharon as Director of Public Health in terms of the safety of the building from the entry into the building right through to the exit. So that covers the meeting room, the comfort areas, the breakout areas, and any other area of the building where a participant of a meeting may attend. We also have to take into account the other users of the building as well, and the other purposes that that building is being used for when we host the meeting. The government has also listed a number of questions that we have to consider. So the government is indicating one of our considerations is, do we really need to have the meeting? So can the decision be made by other means that are detailed within the Constitution? For example, a decision made by the head of paid service. In terms of minimising physical interaction, there can be no sharing of papers. People need to remain at a social distance space within a room. Try and avoid any sort of crowding, for example. So we have to put markers out on the floor to make sure that the social distancing guidance is maintained. We also have to consider whether we need physical barriers in a room to keep people separate. And of course, at York, we don't have that at the moment because it's all an open plan environment. One of the issues that we've got is that we will need to work with public health and safety teams, because our largest meeting room at West offices can only accommodate 10 people. Minimum quorum for a meeting is currently 4, excluding full council. So you have to consider the number of officers required at a meeting, contents of the agendas as well. So will the agenda items themselves trigger a higher than normal volume of officers to come to answer questions from elected members? So when you start with a meeting of 4 and then you start considering the number of officers to attend and how many agenda items you can have, it becomes quite restrictive. So we have to look at those issues. What I have been requested is to establish a working group across all political parties so that we can come to hopefully some consensus of opinion, because there are issues that need to be taken into account. There is also the roadmap period for a first instance, which is May to the 21st of June. We then have to look at the period post 21st of June, because that is unknown at the moment. The additional factor is that there is a judicial review of the government's decision to terminate the ability to host meetings remotely. And that hearing is not due to take place in the High Court until the week of the 20th of April, which doesn't give very long to accommodate whatever that outcome is. A potential outcome of that is that we can retain physical and remote and a mixture or a hybrid of the two. So a third option that the cross-party working group also needs to look at is how will York accommodate, if it's a possibility, a form of physical versus remote versus hybrid meetings as well. So there's an awful lot of uncertainty at this moment in time. Quorum for this meeting, for example, in terms of scrutiny, is 4. So it is much reduced member attendance of 4, and that would be politically proportionate as well. Going forward, we do have to consider, do we really need the meeting? If we don't need the meeting, we also have to consider, as part of the cross-party working group, whether scrutiny reverts back to forum-style meetings, so they remain virtual meetings until such time as we can safely accommodate a physical meeting, for example, or a hybrid meeting, depending on the outcome of the judicial review and further government guidance. But I'm afraid there's so much uncertainty at the moment that it's quite difficult for me to give any certainty at all, apart from we're having a cross-party working group, which obviously needs to meet really quite quickly in all of this. And obviously we've got our annual council meeting, which is currently scheduled to take place at the end of May. And the cross-party working group has been asked to look at the considerations about retaining that date at the end of May, or whether it needs to be brought forward. So again, there's a lot of uncertainty about that. But a minimum quorum for a full council meeting is 12. So we vastly reduce from 47 members.
Thanks, Janie. And just for clarity, I see there's a couple of hands up, and I will bring your questions in. What we're talking about at the moment is what happens between the 7th of May and the 21st of June, essentially. And I think what we're thinking specifically from a scrutiny point of view is that the dates that you have in your diaries, both for this committee and for any other committees that you currently sit on, you retain those dates during that period, but it may be that what have been public committee meetings in the corporate calendar revert to a forum meeting or some different format, because we can of course meet remotely not in a public setting, and there is work that scrutiny committees can do not in a public setting, but we will need to think about how we can manage that. And obviously what the preference is always is to have as open and transparent governance as is possible to deliver. So that's certainly my starting point in terms of where I want to see things go from a scrutiny perspective. Councillor Rowley, you had a question, and then Councillor Mason.
Yeah, thank you, Chair. I mean, it's more of a suggestion, really, an out-of-the-box thinking. Obviously, the council owns a number of premises where meetings could take place, and if I might, and I'm sure it's been thought of, the crematorium is a council-owned building. and it would currently allows up to 19 people to attend socially distanced with risk assessed access and exit, and also has the ability to live stream. So it wouldn't be a difficult call to have a meeting live stream from the crematorium and to use that facility. Just a bit of out the box thinking, but thank you, Chair.
Thank you, Councillor Rowley. I'm tempted to make a terrible joke about not wanting things to be out the box at the crematorium, but that's perhaps not one for right now. Councillor Mason.
Thank you. And that was an interesting suggestion, Councillor Rowley. I hadn't ever have thought of that venue. I suppose one question, Janie, is when it says meetings have to be public, or to revert back to physical public meetings, is there a kind of specification of who has to be there in terms of, for example, could it just be the 7 or 8 councillors that make up a committee, and actually all the officers coming in on a big screen at the end, or public speakers coming in on a big screen at the end, or who is it that has to be there?
I'm afraid it's almost back. If you recall 2019, it's back. It's back to that. I know, so long ago. It is back to that. So to have a physical meeting, you would need the physical presence of Democratic Services officer. You would need the physical presence of, for example, myself or a legal advisor, potentially a financial advisor, depends on the agenda item being discussed. You'd need the physical attendance of the officer that was presenting the report, or you wanted to ask questions of them. The only people who are not expected to attend a physical meeting would be members of the public. The government is very clear that live streaming of meetings must continue to facilitate the public participation and the transparency. So the only people who would not be expected to return to a physical meeting are members of the public, and likewise the press. So we would continue with the sort of methodology that we've got at the moment, where the members of the public can engage via ringing up the meeting and participating that way. So they're the only people really who are not expected to attend a meeting. Everything else is back to all of us. So if you have more of a controversial item to discuss, for example, and you need a number of officers in support of talking to various aspects of a report, you soon get to a maximum of 10, for example, if we used the largest meeting room in West Offices.
Thank you.
Thanks, Janie. I mean, just for context, there are 19 people on this call at the moment, so it's very easy to see how you quickly jump over that number of 10. Councillor Kilbane, quick question from you, and then I'll just draw this to a close.
Just throwing something in the pot, really. I mean, I think there'll be other venues in the city that we could potentially use, like Energize, etc. But I just sort of want to put it on record that this just seems absolutely crazy that the whole world has moved on. We're all talking about hybrid meetings, not needing to go into the office, etc. In terms of accessibility, this makes such a difference to people. It just seems absolutely crazy that there's just this line being put in the sand, and we really, whoever can, should be lobbying the government for more flexibility on this, because the last thing we want to go to do is go into informal private session. We need to keep out there in the public.
So there is an awful lot of confusion out there. Luke Hall is the one who's advised council leaders that the sunset clause, which is section 78 of the Coronavirus Act, and the remote meetings regulations will absolutely expire midnight on the 6th of May. They're saying there's no parliamentary time to enact primary legislation for that sunset clause to be continued. You may be aware that Robert Jenrick is featured on the front page of the Municipal Journal last week, indicating support for the continuation of remote meetings. So it is quite a mixed message amongst the monitoring officer world at the moment. The High Court judicial review is being brought by Hertfordshire County Council, but with the support of the Association of Democratic Services Officers and the LGA. And all monitoring officers in England have been asked to contribute evidence to support the case of the success of remote meetings, essentially, that it's a lot more transparent, it's opened a lot for a lot more people who are, for example, shielding or equality or disability issues, who can't physically come to a meeting. They can now participate in a different way. Local government is a lot more accessible now from a variety of services by mass live streaming. Not just that York does it, but now every council does it. So there's lots of reasons why people like myself and colleagues would support the continuation of what we've got now. It's quite hard to stop something when it's so established and being relied on to deliver local democracy now for such a long period of time. But again, it's quite difficult, isn't it, when there's two people in the government say one thing and then we have a High Court case being, challenging it. So we'll have to wait and see.
Thanks, Janie. I think it was quite clear from this meeting last month that it was a clear appetite across the piece to certainly look at what the benefits have been and what future working might look like in terms of hybrid meetings or continuation of some meetings remotely. So I think whatever support Scrutiny can give to looking at how we can continue to facilitate open and accessible meetings, I'm sure that we would all wish to offer that support. What I'm going to do now is just take us into a very short adjournment, because that item necessarily, I think, has run for a long time. There's been a lot of information there. So thank you very much, Sharon, for your update. You're obviously now free to leave the virtual table, and I'm sure we'll be seeing you again soon. But just to reiterate again, thanks again for all of your work, for yourself and the team. It really is fantastic that the rates have come down so low in York. What I would like to do for the rest of us is just take it, as I say, a short adjournment now. I make it 7:01. So can I ask that we come back to be in the sort of waiting room at 7:05 with a view to coming back on screen to the public view at sort of 5-6 minutes past. So just a very short break. Okay, welcome back everyone to this evening's meeting of Customer Corporate Services and Scrutiny Management Committee. I'm going to move us on now to agenda item 5, which is the update on procurement. And we are joined on screen by Debbie Mitchell, who is the Chief Finance Officer. So Debbie, if you could just talk us through your report. I think we've got some things for us to consider as a committee once we've done that, but over to you, Debbie.
Yeah, thank you. So you were originally scheduled to get a report on procurement in January 2020, but I was unable to attend that meeting due to being off work at the time, so you deferred the report. So what I've done is I've retained the core of that report that you were originally scheduled to discuss over a year ago, and I've added in some further information. Excuse me, including a bit of an overview about how procurement works and a few facts and figures about procurement at the council, and a little bit about how we operated during the early part of the pandemic. But the main areas to really update you on is the procurement green paper. So the government issued that following the UK's departure from the European Union. It's still only consultation at this stage. So what I've done is I've just outlined the key points of that green paper. And I'm also proposing that we don't update the procurement strategy at this point, but that we await the outcome of the green paper. Again, you may recall that we were about to embark on a review of the strategy in late 2019, because the strategy was dated 2017 to 2019. However, my own view is it is still fit for purpose, and my recommendation would be that instead of updating that now for the sake of it, we carry on as we are and look to start the consultation with internal services, with members and with our suppliers, with a view to having a new strategy in place that will pick up any issues from the green paper. So once we know the outcome of that green paper. And then the other item, just to seek your views on, are some proposed tweaks to the social value policy. So the policy's been in operation since December 2018, and officers are just proposing some changes, mainly to incorporate issues relating to culture and young people. Now, I had sent it as a track changes document, but I think somebody's been helpful and accepted all the tracked changes. So I don't think you can see the tracked changes on your version, unless anybody tells me that you can. So I'll just, if it's okay, just briefly outline what those changes are. It's on page 28 of your pack under vibrant cultural offer. One of the objectives was about retaining and developing talent, and we've added to that with children, adults and intergenerationally. And then the only additions are in the examples, the last 2 bullet points, in both examples columns. So creating deliberate connections with local schools and embracing and supporting any community-based opportunities. With the next item, which was National Pioneer in Culture and Wellbeing, we've just added that subheading of creating the most creative, collaborative city. Wow, that takes some saying actually when you say it out loud. And again, it's just the last couple of bullet points in both columns that have been added on as examples. And then finally, what is now world-class ambition and profile was just arts, culture and heritage for everyone. So that's recommended to change to world-class ambition and profile. And then again, it's just the last bullet points on both columns that have been added, and they are only tweaks. So there's nothing significant. It's just to include more around the cultural offer for young people. So what I'm asking the committee is just around really your views around what's in the report, what further information, if any, that you would like this committee to consider on procurement, your views on those tweaks to the social value policy, and again, your views on the procurement strategy and any areas that you don't think are currently covered that you would like to see covered in that strategy.
Thanks, Debbie. So I'll invite members to ask any questions or offer any comments, however you wish to do. And Councillor Fenton is first up.
Thank you, Chair, and thank you, Debbie. Certainly in the time that I've been on CSMC, procurement's always been a topic that members have been interested in and keen to talk about. I was wanting to better understand the timeline in terms of the green paper and the government consultation, and then the refresh of our strategy, and how you sort of plan to factor in, as well as consultation with sort of current and potential future suppliers, opportunities for members to engage in that as well, and just to have a better understanding of the sort of likely timescale and approach. And so first question. Second question was around, in terms of the social value approach, in terms of to what extent we've looked at examples elsewhere. I know that in previous discussions on procurement, there's been reference made to the Preston model, which I know isn't just Preston, but other local authorities have taken a similar approach, and just, I suppose, having an understanding of how our approach compares to that which other local authorities and public sector bodies have approached this, and whether what they're doing represents some kind of silver bullet that that York could take off the shelf and adopt. It's useful to have your views on that. Thank you.
So the timescale and approach to the strategy, there isn't a timescale for the government to respond to the green paper as yet. So I was proposing just to kind of keep it under review really over the coming months. My own view on the procurement strategy itself is that it's kind of okay, and you might want to add things, and we can add things, and we can do things differently. But my ambition really for the procurement strategy was to do something more comprehensive, and so talk to elected members, to officers in the council, other stakeholders, partners, current and prospective suppliers. So what I'm interested in finding out from suppliers are any perceived barriers to working for the council, how they think we might be able to do it differently, and as well as talking to other councils as well to understand and make sure that we've got the most up-to-date issues in mind, and that the strategy covers everything that we need it to cover. So that could take, I mean, it's how long is a piece of string really. I'm a firm believer in that. If you've got 6 months to do something, it will take you 6 months. If you've got a year, it will take you a year. So I would be quite happy to sort of, and I'm a person that works better to deadline, so I would probably set a deadline and then say, you know, we need a new strategy from here, and then work back. In terms of the social value, you're right, the Preston model is, well, it's interesting in that there's no rocket science involved, if you know what I mean. So I think it's quite widely misunderstood, that kind of community wealth building. So, for example, with the Preston model and those anchor institutions, we have done that work here. We've looked at the anchor institutions a number of years ago, actually. And where the position in York, I think, is different to the situation in Preston, where, you know, when Preston started their work, they spent a very small amount within their county, but within the county of Lancashire. And so I think they'd gone from something like 20% to 80% or something like that. And we have consistently been at around the 60% level for a number of years. But what's interesting is that, Preston spending went from 39% within Lancashire to spending 79% within Lancashire. Now, and that figure was not just Preston Council, that included some colleges, I think it was police, and that was the county and Preston itself. So that was a bigger area. Just the council within York spends 60% of our spend within Yorkshire and Humber. So we're already in a much better position, where our starting position is almost like Preston's end position, if you know what I mean. So Preston were just getting caught up to those authorities like York that were already doing a lot in terms of spend with SMEs and spend within our region. So I think we've certainly looked at the Preston model, and community wealth building is something that we can always improve. Absolutely always areas that we could do better. And obviously the last year, 18 months has been difficult for various reasons, mainly the pandemic, which has set us back a little bit in terms of some of that work around financial inclusion and community wealth building. But I think we're in a very good position and much better than Preston perhaps were when they started their journey. So whilst we have looked at some of the behaviours and looked at some of the work that they've done, there wasn't a great deal in there that we weren't already or hadn't already done. So I'm not dismissing the work that Preston did at all. It was fantastic work. It was really interesting. I think where we would perhaps have more, the area where perhaps we're not so good is around that analysis and evidence base in terms of the data analysis. That's one aspect of work that we don't have a lot of capacity to do. So we can analyse our own spend, but we certainly don't have the capacity to go out and do something that brings in other public sector organisations in the city to do that kind of collective spend across a wider remit of organisations.
Thanks, Debbie. I think that last point that you made there is one of the key things around Preston and the way that they've used the council to work with partner organisations so that it's not just one significant body that's taking these social value decisions. It's getting all of the kind of big spenders in an area to all try to use their combined spending power or their individual spending power to a combined goal, as it were, which I think is perhaps the bit that's been exciting about what councils like Preston have done. Councillor Mason was next.
Thanks, Debbie. I've got two questions. One, I was interested around kind of what happened during the pandemic with procurement and obviously existing people we already had kind of supply chain set up with. And my second one was around kind of any future plans, how they would integrate into companies that we own, like Make It York.
Just before you answer that, Debbie, if I could just acknowledge, I think Councillor Rowley, you said at the start of the meeting that you would need to leave around about 7:20. So do feel free to leave when you need to leave. But thanks for your time this evening, and back to you, Debbie.
Yeah, I'm sorry, Councillor Mason, you were asking about how procurement worked during the pandemic.
Yeah, I mean, did we obviously there was a lot made of different people buying things during the pandemic. Maybe the government's example wasn't one that we followed in York, but I just wondered how did we get on during that period? And obviously the existing suppliers we already had, how did we work with them if there was strains and stresses, or if we needed extra things? And then totally separate was about how we would integrate stuff like a new procurement contract and things like Make It York.
Right, yeah. So during the pandemic, you're right, it was, I mean, it seems a lifetime ago now, doesn't it? But there were a lot of issues around PPE, which in my world means property, plant and equipment, but in this context, personal protective equipment. So the procurement team worked really closely with public health and with our regional colleagues. So there was a lot of joining together our spending power to source equipment that was really urgently needed at the time, and working both across the city with health and other public sectors, colleges and so on, but also across Yorkshire and Humber. So we have a really good network across Yorkshire and Humber of procurement officers who regularly meet and discuss different issues. And also YPO were really instrumental in sourcing the relevant kit that people needed, the hand sanitizer, the gloves, the aprons, all that kind of thing. So I think that worked really well. And I know Sharon, I think from a public health point of view, thought that was effective in terms of sourcing the equipment that we needed. We did at the time defer some live procurements, mainly because at the start of the first lockdown, whilst as council officers we were quite used to working from home because we'd always done that over the period, a lot of our suppliers weren't used to working from home. So we took the decision with the executive to defer and delay some procurement exercises to make sure that we maintain that level playing field for perhaps those bidders that maybe needed a bit more time to get their home working up and running. So it was, and also some procurement staff did go off and support other areas as well. So we brought in some temporary arrangements regarding breaches and waivers so that officers could source essential equipment very quickly without having to jump through too many bureaucratic hoops. We kept still some contract procedure rules in place, and we still kept that kind of compliance and register in place. So it wasn't a free-for-all, but there were some relaxations so that we could, which are allowable under the contract regulations. So that was fine. So I think that worked really well. In terms of how we might integrate in future, with other partner organisations. It is a bit of a challenge, perhaps with some of the smaller council-owned companies, but it's something that we could look at. So we do work closely with all our companies. We work closely with Your Waste and other companies on procurement. So it's certainly something that I can pick up and take a look at, actually, because we've not done a lot on that over the last few months.
Thanks, Debbie. Councillor Kilbane.
Oh, thanks, Chair, and hi, Debbie, and thanks for the report. And apologies if this has already been picked up, but not my internet throughout, my laptop shut down. Council laptop, I will add, shut down and threw me out. Are we spending 140 million a year or 170? Did I miss that? Because we've got both figures in the report.
Oh, sorry, it'll depend on the date that I did it. So it's anywhere between 160 and 210, depending on what we're doing during the year.
Okay.
So
okay.
It varies.
Okay, cool. And just to pick up on Councillor Mason's point about Make It York, I've been looking through your tender list this afternoon, riveting reading. I'd recommend it to you all. And I'm really struggling to see from the sort of companies that we directly tender within there how our sort of vibrant cultural offer would come into a lot of their businesses, really. And it would be something that would have to be done through Make It York, and they would have to be the people insisting on it, because they're mainly the organisation that commissions cultural stuff for the council. So we'd have to make sure that, you know, in the agreement that we had with them, that they would be adhering to our social value policy. Sorry, that's more of a point than a question, I think, but, you know, it might be a question if I've got it totally wrong. The question that I do have is, if the social value part of the procurement makes up 10% of the decision sort of scoring as to how you do it, do we not have any sort of red lines that, you know, it's just not acceptable for somebody that we're buying off to have done? So, you know, we could say, for example, they must be paying a foundation living wage, and if they're not, we're not going to purchase from them. We could say if they've been found guilty of blacklisting trade union safety reps, we're not going to purchase from them. Those kind of things. Can we have those kind of red lines in the social value policy?
We can have some of those. We have to be really careful. So the foundation living wage is a good example whereby we can't mandate it, but we score it more highly. We want to work with companies that treat their staff well, pay a living wage, provide all the relevant support and well-being. So we want to work with good companies, and we want to get as much out of those contracts as we can. Procurement people would tell you that you can have whatever you want if you're going to pay for it. So you can specify whatever you want and you can have it, but you'll pay for it. But we, as you know, haven't got a bottomless pit of money. So what procurement brings in is that tension between social value, quality and price. And that's always going to be a trade-off. So you can have something that's absolutely brilliant and meets all your needs and does loads of really great social value, but you might not be able to afford that. So that's when you've then got to just sort of go through that evaluation and get the best balance that you can. So it's about value for money, which is the best that you can get with the budget that you've got. So you always go out for a procurement with a budget and say, this is how much we've got to spend. And then the supplier can tell you what you can have for that money. And with any luck, you get several offers, and then you can evaluate those different offers and come up with the one that best meets your needs. So you could have two bids that were pretty much identical, and they could both have really great social value offers. And you would then have to have a way of evaluating, well, they might both be really great, but you only need one of them. So which one is right for York? So, you know, you can have any number of examples. One might do something of working with families with autistic children. One might do something for children leaving care. They're both really great things, but which one do we need more? And so that's where the procurement process and the evaluation comes in, so that you're scoring that against a clear set of criteria. It's not just, oh, we like the sound of that one, it sounds really interesting. It's clearly evaluated, it's scored, it's marked, and it's defensible.
Councillor Kilbane, I think it was a supplementary.
So just to be clear then, so we could mandate, for example, that anybody that we're procuring off must pay the foundation living wage. If we chose to, we could do that.
I would need to check that with the legal team, because there have been some challenges in other councils around that. and you just need to be careful that you don't rule yourself out of the market, because let's not forget that we are buying things from third-party organisations who, in order to pay their staff a foundation living wage or a genuine living wage, need to be making a profit. So we don't need to, we shouldn't shy away from the fact that these organisations need to make a profit, and what we want them to do is plough that profit back into the city, essentially, don't we? And we want them to employ local people. We want them to use the local supply chain. We want them to help continue to make York a really great economy and a really great place to live. And so it's looking at it in the round. It's I joke about this, and I'll say it tonight. The answer to any procurement question is always it depends, and it genuinely does depend. So we'd have to take some legal advice on that issue. But the concern would be that we would price ourselves out of the market, and then we would go out to tender and nobody would bid for it. And then we're back where we started.
I think it might be a moot point in a way to pick up on, but I think the one thing I would just note within what you've said there is I think where the council has some real power is to demand that actually a business that's viable and profitable passes that on to the workforce and the people that are employed by that. And so I would be quite concerned actually if what we were saying was we will only expect the living wage, foundation living wage, to be paid if the business is operating at a profit, and I think probably what you meant is operating as a viable business, because I think that is sometimes a concern, isn't it? Is that we may procure something where actually, a differently structured organisation may be able to deliver a better settlement for the, well, hopefully local residents who are working for that organisation, and I think that's certainly been some of the ethos around the community wealth building type project is to say, well, actually, let's try to put as much money into the pockets of local people as we possibly can, because that's good for all parts of the local economy.
Yeah, absolutely. And you're right. It's we all want to use local suppliers and all that. It's all really great stuff. It's just that tension between what we can afford and what we would like. So, and just to make the point that we do request that everybody's paid the foundation living wage, and the vast majority of contracts are. I think there might be one or two that I would just need to look into, but we do have that as a standard requirement. We make it clear that we expect those kind of fair working practices, one of which is that we expect our suppliers to pay their staff a living wage. So that is all kind of as part of those tender documents.
Thanks, Debbie. I've got Councillor Kilbane with his hand up again. I'm just going to jump in just because of that point around the living wage. And there was just a couple of questions I had just in terms of the existing procurement strategy. And you said that for the time being, that will continue beyond the 2019 date, obviously. There's obviously one or two things that have just changed a little bit. And I wondered if there's a chance or an opportunity to either update this as a working document, whether it needs it. On page 20, there's a couple of references to procurement sitting within Customer and Corporate Services Directorate and the executive delegating authority to the Director of Customer and Corporate Services. But obviously with the restructures that have gone on, that maybe isn't quite an accurate reflection of how that operates. And then on that point around the living wage, on page 21, it says the requirement for a payment of the living wage will be explicitly made clear in the tender documentation. But obviously there's a distinction between the foundation living wage, which is referenced in the social value strategy, and the living wage, which I think certainly central government sought to kind of hijack to really mean the minimum wage. And so it's just to perhaps, could we make that really explicitly clear that what we mean is the foundation living wage? Yeah,
you're absolutely right. It was because this was before the social value policy, and it means a foundation living wage. You're right. The government hijacked the minimum wage and called it a living wage, but we mean a different thing here. So yeah, and I take your point. It needs updating a bit. And I'm not against updating. I'm not saying if members want it to be updated, we can do that. I just think we would do a better job of it if we awaited the outcome of the green paper, but I can certainly do an interim review just to tidy it up. That's fine.
I was just thinking in terms of technicality, just in terms of transparency and openness, just where it needs that. Councillor Kilbane.
Thanks, Chair. And just on that, really, Debbie, I was just wondering if any work's been done in terms of how our current social value policy is working with the contracts that we've already got. Is any work done along those lines to see if there is compliance to sort of what was offered when the contracts are entered into, and whether or not that's actually being complied with in practice by the organisations we're doing business with?
Yeah, it is. And what I don't have, and I think I've talked about this quite openly at various meetings before, what is a weakness of our current arrangements is I don't have a central contracts. We don't have a central contracts monitoring function. So once the procurement team has supported a service manager to arrange for a contract, it's then over to that service manager to manage and monitor the contract. And so I don't have, as a matter of routine, that information coming back up to a central point. So I have to go and ask. So I will do that. And we do that fairly regularly. We just go back and ask for that monitoring information. Again, I think I've been clear before that in some areas of the council, contract monitoring is done really well and really effectively. So adult social care is a good example of where it's really done well. In other areas where managers are maybe not as used to commissioning and working with contracts, they need a lot more support. So we have put together, I don't know if I can keep using the pandemic as an excuse, and I don't mean to, but pre-pandemic we had put together like a bit of a toolkit for managers that took them through what their responsibilities were in terms of contract monitoring. We didn't roll that out because people were busy doing other things. We have now started to roll that out across the People Directorate, and we've done some training with them, and we just need to step that up now and roll it out across the rest of the organisation, and just again remind people that we don't let and forget when we let a contract. Actually, the procurement is should be a really small part of it, and that the bulk of the work is in once you've chosen your supplier in effectively managing and monitoring that contract to make sure that you get the outcomes that you specified. So that is something that we will look at.
Councillor Kilbane, if that was supplementary.
Yeah, just so basically including social value policy outcomes as part of the deliverables. So yeah, we've seen that you've built the building, but how many young people did you retain and develop and all that kind of stuff, or how many murals have you got on there, or whatever it is?
Yeah.
Okay. Right. Okay.
Thanks. Councillor Musson.
Thanks, Chair. It's just to ask whether you've possibly considered including, I know there's a bit in there about guaranteed interviewed for the unemployed, but there's obviously the disability confidence scheme where employers can offer guaranteed interviews to candidates with a disability. Would you consider including that in there as well? I think that's something that some employers in the city already have, but could be quite beneficial to providing social.
Yeah, I think we do put something in about the disability confidence scheme in the tender documentation. I would have to double check because I'm not that familiar with the detail of the documentation. I think the other, it's interesting, isn't it, that when we do talk to suppliers about maybe what it's like to work for the council and what it's like to bid for our contracts, one of the things they say to us is that there are kind of 3 or 4 pages of stuff that they have to do before they get to what it is that we want from them. And so we often say we make no apologies for requiring some of these things. We make no apologies for requesting the foundation living wage, and we make no apologies for insisting that treat staff correctly, provide training, health and safety, all those things. But there is something about how we can maybe change our documentation to make it more accessible, make it more user-friendly, particularly for like those smaller businesses that are maybe don't have teams of people that are bidding for tenders, that are doing it themselves on an evening and a weekend. So that I will double check. I'm pretty sure we do put something in about that, and if we don't, I'm sure we can include that. Yeah.
Thanks, Debbie. I can see Councillor Kilbane's hand up again. I've just got another question that I'm just going to ask you, and then I'm going to just start as wrapping this up as well. So I think the idea about sort of looking at a strategy review in line with the government paper, I think is a sensible one. That certainly seems to make sense. In terms of who owns that review, how do you envisage that happening, and who actually would be the ultimate decision maker from your perspective on that? Because I'm just wondering where Scrutiny might potentially be quite a useful tool within that sort of a review.
Yeah, it would be executive that would agree the strategy. That's a function of executive to agree that strategy. But yeah, I'm happy to take views if you wanted it as a scrutiny topic. Some of the work that we will be doing is looking at what other councils do, looking at other council strategies, talking to suppliers, talking to colleagues. More than happy to be bringing that back through this committee if that's something that you were interested in, so that it was scrutinised and something before it went to exec. I'm open to your suggestion and thoughts on that.
So of course, members, just to remind you all, what we can do as a committee is look at a topic, look at areas, and make suggestions or recommendations to executive. And obviously, executive are ultimately the decision maker. But it does seem to me that there's potentially an opportunity here over a period of time to have a look at best practice, because I think we're probably all on a very similar page with regards to social value and using the council's procurement tools to deliver the outcomes that we want to see in the city. So it's maybe something just for you to think about as to whether or not it's something we might want to take forward with a view to potentially making some recommendations around a strategy that executive might subsequently adopt or not adopt, depending on how good our recommendations were, I suppose. Councillor Kilbane.
Just very quickly, Chair, I'm also minded to the fact that we have a piece of work to do on ethical asset disposal, and it would be good if this social value review could actually inform that as well, because it might save some of the work that we need to do around that.
I certainly think that they're potentially two sides of a, if not the same coin. It's too late for making analogies. I was going to say coins in the same till or something like that, but there's definitely a relation between them both, isn't there?
They would both sit under me, and in terms of the asset disposal is a chief finance officer policy, and so yeah, they would both sit with me. So yeah, they would make sense to do it parallel. That would, yeah.
Yeah, thank you. The other question that I just had, just as a last point, was just around the contract management and contract monitoring that you mentioned, and it being done perhaps differently or more or less effectively in different areas. And again, that seems to me to be a really key thing, because obviously we can have all the best policies in the world, but if they're not delivering the outcomes that we want to deliver, then that's not necessarily much use. Has there been a review of contract monitoring? What, aside from you going looking, because I think the thing you said was you don't routinely receive that information, and that kind of surprised me a little bit. Is that something that is underway, or something that, again, might be something that we could perhaps help with, or what's the current thinking around that?
We did do a review of contract management, which was why, and we found it was good in parts and not so good in others. So that's why we came up with the kind of guidance for officers and the toolkit. Without having, I suppose the other thing is that, as you're aware, we currently use a system, Your Tender, which is the regional procurement portal. That system is contracts coming to an end, so that system's being re-procured as a region. We're not doing it on our own. The region is re-procuring that, and one of the aspects of that system hopefully will be an improved way of contract monitoring, so that we can we've got a place to put the information. It's a bit like the social value. You're absolutely right. It's one of the things we've said all along, that you can put in what you want in the procurement, but if you don't check that they've actually done it, then what was the point, kind of thing. So it is a real key issue, that check back, and that's really important for when you come to then procure whatever you do next after that as well, because you need to have that continuous kind of loop, that feedback loop, to make sure that you're collecting all the right information. So hopeful that the when we get the new system, that will have an improved way of contract monitoring. What I didn't particularly want to do is have a series of massive spreadsheets, for example, where everybody put their information. So it's something that we need to look at, is what I'll say. We have done a lot of work on it already, but it's quite a bit more to do on rolling that out across the council and embedding with managers what their responsibilities are once they are a contract manager. So if they're not managing staff directly, but they're managing a contract to deliver that function, then that's equally important, and they need to have those regular meetings. They need to be gathering that information. They need to be taking action if they're not meeting the contractual obligations. It's quite involved.
So I guess what might be helpful then, if there's already something in place around the Your Tender review and how that will impact on contract monitoring, when that has come through, then perhaps that's something you could bring back to us here with a view to this committee considering whether or not there's anything more that they want to do on that specific aspect. But I guess there's not much point in reviewing things if it's already being reviewed elsewhere. But I think that might be helpful. To come back.
I can share with you the contract management guidance that we've got ready to issue, if that would be of interest. I can send that round afterwards if you want to, if that's anything that's of interest.
I'm seeing some nods, so I think if you could, that would be helpful. Councillor Fenton.
Just to follow on, really, in terms of the Your Tender renewal, what opportunity will we have to input into that decision, the things that we would like a new system to do? Just thinking of the current functionality and how we might like to use that to sort of piggyback on that contract management function as well as a procurement function. Is that likely, do you think?
I personally don't think there's a role for members in getting involved in the specification of the procurement system that's used across the region. I think it will, it's about affordability as well. So we can only afford to do so much with the system. And there are a number of different ones to choose from, but they all kind of do pretty much the same thing. It's like finance systems in that respect. You can have as many modules as you like. So I think that what we're going out for is a procurement system, and public procurement and contract management and data analysis is all part of that, and there'll be a number of modules that potentially we can use or not use depending on what system's chosen. But because it's been done as a region, then obviously there's like 20 different authorities, I think, all putting into that.
No, I wasn't suggesting that members should write a spec for, for a procurement system. Some may want to. But as long as obviously we're involved in those discussions, and that's we as in the local authorities. So that's fine.
Yes. Yeah.
Thanks. I'm not seeing any further questions. I guess in terms of what we're being asked to do in this report, I think obviously we've made comments. We've hopefully given you a couple of things to take away and come back as and when, Debbie. The only thing that I'm just wondering how we manage, because obviously we've talked about measurement of success or otherwise of the strategies, and I think some of that comes through contract management, but perhaps also we may want to think about reviewing what some of the outcomes were of the 2017 to 19 strategy and to what extent they've been delivered. I think that probably is part of the procurement strategy review that you've talked about as being something that's kind of to happen as and when the green paper comes forward. But obviously we have already begun this looking at the ethical disposal policy and what potentials there are there. So I'm just thinking, committee members, whether or not what we might want to consider is just to broaden slightly the remit for the group that are having a look at the initial scoping that we discussed last month around the ethical disposal policy. I don't want to add too much to your work in a short frame of time, but just to perhaps consider alongside that how Scrutiny might support and constructively engage with the review of the procurement strategy, and in such time as it comes forward, with a view to potentially getting involved and making some recommendations if that's deemed to be appropriate. Does that seem like a reasonable course of action? Councillor Fenton, I can see your hand up.
Yeah, I think that's a sensible place to start, and it's probably a a task for myself and Councillor Kilbane and Councillor Pearson. I'm conscious we haven't yet had our conversation about asset disposal. So I think as and when the three of us can get together, probably starting with a conversation with Debbie, we can cover that as part of that conversation in terms of planning that work. So that's, if people are happy with that.
Yeah, I think everyone seeing broad nods, and yeah, great. I'll take that as the takeaway from this evening, and we'll obviously bring it back to committee as and when we know anything a bit more concrete about what we're wanting to do. So thank you very much, Debbie, for your time this evening. Thanks for hanging around. It's run on a little bit longer than we expected, but I think it has been very useful. Obviously, you're now free to leave the virtual table. And I will invite Claire Wayne and Ian Cunningham for agenda item 6. Thank you so much for waiting this evening. I think the first couple of agenda items took a fair bit longer than I was originally anticipating, so apologies for that. So we're just here to discuss the future of Medigold, or the Medigold element of the Council's approach to absence management. So I don't know if either one of you wants to just give us a sort of brief overview update on where we are, and then take some questions from members.
Okay, yeah, thanks, Chair. So if I just give a couple of minutes, just a bit of an overview. So sickness has been something that's been discussed at CSMC quite a lot over the last few years. We've obviously had some challenges within the authority around sickness rates. So it's something that regularly gets attention and comes back for discussion. And around about 3 years ago, we actually had a fuller discussion where I think the leaders of the council at the time came into the CSMC, and we discussed potentially a slightly different way of assisting the organisation with dealing with sickness. So a process was put in that was commonly referred to as Medigold. And in effect, that was a process that's been running now for about 18 months of a 2-year agreement. And it gives the organisation access to a slightly different sickness procedure, which is slightly more arm's length. Okay, it gives us access to call centres. It gives us access to lifetime information. And there's much more process-driven structures around sickness than we previously had in the authority. So if we run back a number of years, sickness processes in the authority have been very much around paperwork, physical bits of paper being passed across, being stored, structured in that way. And what Medigold gives us is a much more dynamic process where, as sickness occurs, it's that information is available to the organisation to make decisions upon. How well's it gone? I mean, I've made some comments in the report about it's very much integrated now into the processes of the authority. It worked extremely well in COVID, but I won't take any thunder away from Claire on that. And it's probably helped, or it could have helped the organisation with the sickness rates. So I use the words probably and could because, a bit like the other items we've discussed tonight, COVID's appeared in the middle of the introduction of Medigold. So we have to be pretty careful, sensible about drawing too many conclusions there. But the conclusion I would say in the report, and you can see it with the sickness data, is the sickness rates in York have fallen over the course of the introduction. And we've done a little bit of work with other authorities within the Yorkshire and Humber region, and their views are, because sickness is slightly captured in slightly different ways, there is no statutory method of capturing it and reporting it to the government. The views across Yorkshire and the Humber are that sickness has fallen also in their authorities, but probably not to the extent that we've seen in York. And there's a paragraph in the report which talks about probably where we've had the biggest impact, which is medium and long-term sickness cases, where the introduction of Medigold has really assisted the organisation and the managers of the organisation and the employees about collecting together the data and the information to support everybody from all angles, whether or not that's a process that's going through, or whether or not that's employees getting the assistance that they require because of sickness. So it's been generally quite well received, okay, across the organisation. I'll pass over to Claire to maybe say a few words on that.
Thanks, Ian. And I think the overall feeling across the organisation is that Medigold has been a good introduction in terms of process. Process is used a lot in terms of the terminology, and I think what we just need to add into that is that it's something that promotes and starts conversations with staff. So when a member of staff calls to Medigold to report their absence from work, that's 24/7 service. And I think in terms of dealing with things in a timely manner, particularly through COVID, it's allowed us to be able to capture information really quickly and make any decisions that we need to make swiftly about supporting staff when they're not at work. So not just for COVID, but for if anybody calls with musculoskeletal or a stress, anxiety, psychological issue, that's really quickly reported to the manager and it gets people support where they need it quite quickly. And from the start, that's been really well received by staff and really welcomed by trade unions in terms of how we can help staff get support where they need to get that support. So for COVID, it's been really fantastic that we've been able to get information much earlier to the organisation about people that are not able to be at work for that day. So we've been able to report swiftly to CMT and to managers about who is on, particularly frontline staff, how we can make sure teams are delivering the service they need to. As I said, it's 24/7, it's really timely. We've had no specific issues raised by members of staff or managers. In fact, managers themselves have found the system very useful because it's quite intuitive. Overall feedback's been good. We've worked with Medigold themselves or Absentia themselves. If we needed to tweak or change the system, they've pretty much responded immediately on that, particularly with COVID. They've been really responsive in terms of the contract management. Really, overall, Ian, I think it's fair to say that we've worked really well with Medigold themselves. Trying to change the culture of the organisation, that's where it helps, because it's a system that supports managers in starting the conversations with staff and making sure that they're supported. And we can't really ignore the fact that it works alongside absence management processes as well. So we understand where people are hitting triggers, where they've got return to work interviews that are particularly they're outstanding. So those return to work interviews are integral and really important in returning people to the workplace. So moving forward, people coming back into the workplace, Medigold itself will really help capture any of the information about people's anxieties, any long-term sickness issues, triggers, short-term sickness is all captured, and the data's there for managers to be able to see and react to very, very quickly. So our reporting systems have much improved. So we can see sickness hotspots in areas we couldn't see before. So there's a whole load of data that's been able to be accessed by managers and reported to senior managers that hasn't been there in the past. Ian's right about apples and pears and how long we've been able to be able to compare the sickness data pre-Medigold and as we are now, because COVID's given us that little bit of a bump in the road to be able to compare and see how sickness has either increased or decreased.
So just following on a couple of last things there.
Yeah.
So before we move on to a bit of a discussion is, I mean, it's been a challenging year, hasn't it? Especially about recording sickness around employees and all the different circumstances. And actually, we have a very good relationship with our supplier that's allowed us to kind of adapt and move the system very swiftly with the changing landscape. We've worked very closely with the unions over this period, over the last year and a half, in order to make sure that all parties are happy with the processes that we've put in place. And looking forward, I think that there's probably a few more efficiencies and a few hard to reach spots within the organisation that have been identified and that we're working towards. So within the paper, it sets out 4 possible options going forward, which are probably either to extend this current agreement, look to the market for a similar agreement, move the processes back into CYC as previous, or move the processes back with a little bit of additional input within HR. And we've brought the report through to CSMC today, really, to collate or pick up any feedback, either now verbally or if anybody wants to speak to us afterwards, in order to put into the final executive report with recommendations for the future direction. So thank you, Chair.
Thanks, thanks, Ian, and thanks, Claire. And I can see a couple of people just with their hands up who I'll bring in a moment. I just wanted to understand a kind of a key point of clarity around this, because I was involved in the call-in when it first came to CSMC in January 2019. And one of the things that was said and stressed quite strongly by the then leader of the council was that this was, the venture fund was funding this. It was a 2-year project. It was to kind of address something that was an issue at the time, and that the expectation was that in that 2-year period, managers would change some of the culture of the organisation, change the way that we operate, and that we wouldn't need to extend this beyond that 2-year, because it was a kind of a not quite short, sharp shock, but it was that, you know, that idea of we're using the venture fund to make an intervention, and then we will revert to, you know, hopefully have changed the culture of the organisation, look to manage this sort of thing in-house with lessons learned going forward, and hopefully a more skilled management team in terms of how they deal with day-to-day sickness absence. I'm not getting that from this report, and I'm just wondering where and why that's changed. And I'm assuming that any future procurement of Medigold would have to come from a revenue budget rather than a venture fund. And so I just wondered if you could just talk to me a little bit about what's changed over that 2-year period, that what was initially a single one-off intervention has now become potentially a long-term contract with an external organisation.
Okay, so maybe if I pick up a little bit for that first, and then Claire comes back. I'm not sure, Chair, that much has actually changed from that initial statement. I mean, it really hasn't helped having COVID in the way. I sound a bit like Debbie in the last slot there, saying that the world's been difficult for a year. But I guess that we have already started to see some of the impact of that culture within the organisation. So if I talked about managerial actions and outstanding managerial actions, there's very, very few that are now outstanding within the organisation that we can track, which shows, I guess, that the culture of the organisation is starting to move, where you described a bit of the short, sharp shock and then a different way of working. But it has only been in place for 18 months, and we're quite a wide, disparate organisation at times. And I think probably feeling that it is a slightly longer period of time. Now, if we were looking to go back out to a contract, I don't think we're suggesting actually it's a long-term contract. I think we're suggesting possibly that it's probably a shorter term, looking around about the space of a year, reviewing on a non-COVID scenario to see actually how much impact it's had on sickness rates and whether or not we are mature enough as a group, as an organisation, for both employees and managers in order to move on from that point. And then longer term, well, I guess that the organisation also has some pathways it can go with its HR system. And one of the questions, I guess, is that we'll have to discuss or face in about a year's time is which way do we want to go with our HR system, and whether or not we might bring some of those processes back in-house and align it with those at the same time. So I think the opportunity is still there to do it. And I still think the ethos and the reasons that we went into at the start are still in place, really. Claire?
The same as you, really, Ian, about the fact that it would have been absolutely that 2-year process had it not been for pandemic, really. And the other thing, just to add, in relation to the wellbeing aspect, because it's hand in hand with the short, sharp shock bit around process, which drives the conversations and the wellbeing piece. So it's in tandem, really. And the longer term plan, I think we talked about it right at the start, Councillor Crawshaw, was that what would be ideal would be have that end-to-end process building with occupational health. So all of the other things that go alongside the payroll systems and support for staff, to have that element that's seamless, really would be something we'd want longer term. We've just had that, it's not, not minor bump in the road, but we're not able to do that comparator that we would have liked to have done? Coming back to you now, a year on, just a bit over a year, it would have been a different conversation had we not had COVID. We'd be able to just determine what the figures really look like.
Thank you. So I've got 3 hands up. I'm just going to take you in order. So Councillor Hollier first.
Thanks, Chair. Just in terms of those options on pages 46 and 47, I was just wondering, so in option 3 and 4, there's a sort of internal year 1 cost of 40k. Is that the cost basically of returning us to where we were, rather than the kind of, it's not a sort of estimate of how much it costs in the existing manager's time, I suppose, and other costs internally? Is that just literally the cost of returning to the sort of previous system? And if so, is there an estimate of how much money, on the sort of flip side, the council saves by managers having a bit less to do in this area, to make a more sort of rounded, I guess, comparison?
Yeah, so there's definitely an answer to a part of that. Yes, the 40k covers the cost of almost dismantling all the infrastructure that's been put in place in order to have the Medigold system in place. There's been a lot of data challenges. Integrations is one of the reasons I'm involved. That there's a lot of secure data storage. There's things that need to be untangled, and that the previous processes that were there would just need to be brought back up to speed. And so that's why that cost is there under option 3. You'll see in the option 4 that there is a small additional cost into future years if we decided we wanted to build on that model internally. So that was question 1, and question 2 was, I'm sorry.
Well, I mean, I googled what BAU means, business as usual, so I've learned something there. But just in terms of whether there's any estimate of any saving, I guess, to the authority, because managers are not doing this, they're doing something else. If we've got 500 managers and they're all saving an hour, we earn on average X. So
we haven't put that piece of work together yet. That's something that could be done. We've had a look at the estimated cost of savings for people being in work who would previously not have been in work, and there's some paragraphs that state the figures around that. But we haven't completed the piece of analysis to ask managers how much time is saved or energy saved every day, and then converted that into a financial figure. But that's something we could look at doing to put into the final business case.
Okay.
Thanks. I was the same as you, Councillor Hollier. I wasn't sure what BAU was referring to, but then noticed actually at the back of the report there's a list of all of the acronyms and the definition of what they all mean. So there was a couple in there at first that I was slightly baffled by, but it's always good to go to the last page. Councillor Kilbane.
Thank you to both Councillors Hollier and Crawshaw, because you've stopped me exposing my ignorance to the thousands watching on YouTube, because I had no idea what BAU meant, and I didn't look at the back page either. So, and the other thing, the other daft question that I've got is, how do we measure absence levels on an hourly basis? How does that happen?
Sorry, Councillor Kilbane. In the report, does it state around measuring sickness on an hourly basis?
Yeah, page 39. Levels of absence were able to be checked on an hourly basis, paragraph 15.
Okay.
I mean, that's, it's quite something.
Yeah, so I think that paragraph there refers more to how we dealt with resources around COVID. Yeah. So in the first few weeks of COVID, the world was a very confusing and a challenging place, and there was lots of pressures being put on the council. And previously, we would have had a system where sickness would have been reported to a line manager, but it wouldn't have been able to be seen centrally or corporately for a number of days, actually, maybe even for a week or so while data got put into systems. But the Medigold process allowed us to set up a number of kind of data transfers that allowed us to see where people were unavailable by team, by structure, by manager, able to report a lot of that into all the emergency planning functions, into the various gold and silver commands, into the forums that Sharon was describing earlier in her item. And as an organisation, that's so important, isn't it, to be able to know what resources you have available to you and where you can deploy them. And I'm not trying to make a case for us running like a military organisation in deployment of resources, but actually knowing which teams were struggling, where individuals needed support during that time, where actually we needed to find assistance for managerial processes which couldn't fall over. Having that live time information by the hour certainly helped the organisation.
And for it to be reported, because when you talk about sometimes days later, some of that was never reported. So and we could have people lost in a system that needed support. So it wasn't just for COVID reasons, you know, people were ringing because they needed to be somewhere else that day to support somebody else, and we made sure that they had the support then. The knock-on effect was really helpful.
Thank you. Councillor Fenton.
Thank you, Sharon. I think, as Ian said at the beginning, you can look at the figures and you can come up with lots of different hypotheses as to why why we've seen a fall in absence rates, and as someone who's sort of been working from home for a year, one thought that occurred was, well, because of the changing in work patterns, are we seeing people who otherwise would have not been in work physically because they're not well, but are able, or feel that they're able to work because they're working from home, even though in other circumstances they wouldn't have been at work. So I just wondered what, as part of the Medigold process, what assessment you've done and what work you've done with managers in terms of getting the message across to staff that if they're not fit to work, they're not fit to work regardless of whether they are home working or would be in a sort of frontline or office-based system. And I guess it's another one of those issues that, certainly in my mind at least, it supports a continuation of this programme in terms of better understanding whether some of the things we've seen have been in part a consequence of the way we've worked for the last year, or whether it's a more fundamental change.
Yeah. As part of the launch and the continued kind of engagement with staff, we were really clear about, if you're not well enough to be at work, you're not well enough to be at work, whether it's as we are now on these calls, or whether you physically need to be in the office space or anywhere else working in any role. So that's been continued on with training sessions for managers, communications out to staff, and built into a wellbeing group that is now meeting, which this Medigold plugs into that agenda permanently about staff wellbeing. So all of those conversations, or that topic that you've just mentioned now about, are people well enough to be at work, and does Medigold help with that support? We've gone out to staff on several occasions in areas that have needed, we needed to understand more about how staff are working at home. Children's social care being one of them, adult social care being another. So there's a lot of surveys and detail coming back to us that we're working through. And that will link into the workplace readiness group and the workplace wellbeing group that trade unions are sitting on, both of those groups. So we're getting that feedback directly from the trade unions, and we're constantly in dialogue with staff. So understanding how people are feeling when they're working at a distance will continue on for some time. So we've also gone out with a survey to staff about returning to the workplace, whatever their workplace might be. So I think we'll capture that over the coming months, and Medigold will help us with that. Our monthly contract meetings with Medigold will cover some of that ground with them, because they're asking what more can they do to help us as we come out of the current working arrangements and go into what's going to be slightly different for some people.
Thanks. And Councillor Mason.
Thank you. I just wondered, in that period, if you're saying you're looking at a year or so extending it, how does the Medigold system fit in with kind of much wider work around developing staff wellbeing and other kind of programs that are supporting that?
It fits as part of the overall wellbeing piece, that group I've just mentioned, Councillor Mason, is exactly where that sits in there. So all the survey with Medigold goes straight back into that group, and we discuss the findings of that and how we can build it into any other offers that we've got for staff, because we've got a pretty wide offer at the moment for all employees, and we're just working with the comms team about how we make sure that everybody's accessing that information and they can see what's available to them for wellbeing support going forward.
Thanks.
There's a 12-month action plan that fits in with, so there's tangible, it's not theoretical wellbeing, it's actually practical access to practical support for staff, and it links into the occupational health contract, which is key really, and to make sure that we can get people the support they need at the right time.
Councillor Kilbane.
Thanks, Chair. Yeah, I mean, there is clearly a job of work to be done, isn't there, about the impact of the lockdown on staff attendance, because the number of sick days dropped quite dramatically, and if one of the main causes, about a third of our absences are caused stress and mental health, isn't it? So there might be a correlation between people not working from West offices and feeling better, and we need to understand that, because that could have a much bigger impact than any of the Medigold stuff. I know that at the end of December, Trudy was predicting that absence levels would rise again as people start to self-isolate with new strains and stuff. Is that the case, or have absence levels continued to decrease?
So we've not seen a rise yet, Councillor Kilbane. I spoke earlier about we talked with some of the other heads of HR across Yorkshire and Humber, across the local authorities there, and one or two of those local authorities have started to report a rise in stress and mental health cases. But no, actually, our figures have continued to come down. I promise you I haven't been falsifying them as we go along. But we run a 12-month rolling sickness, so it would take a little while till we saw an upturn in the public figures. But actually, in terms of the numbers of days and the number of people being absent from work in February and March, we haven't seen those come back yet. That isn't to say that it won't happen, but not statistically yet.
Councillor Kilbane.
Yeah, I mean, that's just really interesting, isn't it? Because Trudy was definitely expecting an upswing by now, and it's not happened. And to understanding that could be fundamental to what we do with our absence management systems going forward, couldn't it?
I think we might have a little bit of a bumpy ride over the next few months, just around staff anxiety in terms of what next. So that constant engagement and that piece of work is happening at the moment, about how we get the feedback from staff and how people are feeling and how we can support them. Because I think we might have a little bit of a surge in sickness absence going forward, and it may settle again. I just think it's that unknown at the moment. The best way to deal with it is to make sure we're capturing it early, because that's the piece that Medigold has done really well, which particularly on the mental health topic, that we get people quickly to get support when they need it, and staff and managers are encouraged and have to have that conversation with staff straight away, rather than people just not having the ability to be referred to occupational health quickly. So not leaving it for months and months on end. So when triggers are hit, the HR teams can be on it early to support managers with those conversations. And we didn't have that ability to have that daily access to information. So it could be weeks and weeks when people are lost, and we won't get that this time, hopefully.
Thank you both. I've just got a couple of quick questions, and then I'm going to just wrap things up. Just in terms of understanding the way that the Medigold rollout has been received, and you talked quite positively, but there's just a couple of stats that I can see that sort of don't bear that out. I can see that some of them do, but just wanted to get your thoughts on paragraph 28 on page 41. Says that there's around a third of the organisation staff who have not needed the process and question why it was there, and around 15% of staff whom feel that it doesn't provide assistance in managing sickness. So by my count, that's 48% of staff that aren't glowing about it, shall we say. And then paragraph 30 over the page on page 42 says only 25% of staff thought the service was beneficial to them as an employee, and 34% disagreed. So I'm guessing there's quite a lot of don't knows in the middle, or perhaps haven't had to use it. But you seem, other parts of the report and some of what you've said seems to be sort of saying that it's been positively received, but that doesn't seem to be as positive in those statistics as perhaps you're presenting. I just wondered what your thoughts were on that.
So if I maybe have a go first.
Yeah, Ian,
So,
yeah.
so you can see we're not trying to hide anything with the data.
No.
Okay, so being kind of that open and transparent bit. So when I've looked at the results and I think about it, it's not that I'm unhappy with them. Do I feel that they pose more of a challenge to us and the processes we put in place? So if I take the first one that you described, around a third of people not needing the actual process, I mean, there is sickness across the authority, but there are teams across the authority that have very, very low levels of sickness, odd days here or there. And so actually it doesn't really come as a surprise to me that around about a third of people, as we said there, actually haven't had to use the processes. There'll be staff that either haven't had a day off sick and haven't had to phone Medigold, or there'll be managers that manage staff that also haven't been through the sickness process. And so when we've gone out with the surveys, we have gone organisation wide. We haven't sent them just to the individuals that have had sickness. So I know you used the figure there of 48% by taking the two things together. I think the one that we would like to challenge probably is that it's the 15% of staff who feel that it doesn't provide assistance. And actually it's working with some of the managers and some of the individuals that have had to deal with sickness, because these are difficult circumstances and sometimes very difficult conversations. And not everybody always wants to take the organisational advice and line. So I guess that helps us establish there. Your second point about thought the service was beneficial to them. There's a figure there, 24%, a quarter of people thought it was beneficial and 34% disagreed. Well, I mean, my reading of that is that there's a lot of sickness within the authority, which is short-term sickness, which doesn't require support afterwards. So somebody who might have an upset tummy and be off for a day might fall into that 34%. They use the process to report it in, but it doesn't actually gain them a benefit at the end. They just follow through the process. So I'd be concentrating a bit more on actually there's 25% of staff who've actually used the process who feel that they've got a much better outcome and a better service is the wrong word, but they've been able to be better supported going forward because of using the process. So the 34% of people I don't think are always looking for a really good outcome. I think if we repeated the survey, I definitely think I'd ask some questions about whether or not people were drastically unhappy with the processes or gave them a poor outcome. So that there's something there about question wording on my side.
Yeah, the wording we could have maybe been slightly different. But what we haven't found, and we usually do find it, if there's a problem with it, trade unions normally tell us quite quickly. Their members are on it. They're on it with their members, and they would give that feedback. So that's made me less worried about that than I might be, because we've got that dialogue that would be quite open with them, and we're really working in partnership with trade unions on it. So if there was anything dramatically concerning their members, I think we'd know quite quickly about it.
That's really helpful. Thank you both. The second question, and it'll be my final question. I can see we're getting close to 8:30, and I'm breaking my rule about never going over 2 hours on a meeting. So apologies, everybody. It's just the four options that are being presented. You've talked a couple of times about this just being a 1-year extension, but each one is setting out a 3-year time frame on things. So I just wanted to clarify that, and then just going through the different options. Option 1 is suggesting that that's the most expensive of the options, and that there's very little scope to reduce costs over the longer term. The option 3 and option 4, which both have a cost associated with the migration of data or systems or what have you, but then don't seem to have the same sort of on cost. Presumably, after a year of an extension to Medigold, if you then decided that you wanted to not extend that contract any further and take things back in-house, you would then be left looking at option 3 and option 4 or something similar to those anyway. So I just want to sort of understand why one of the two more expensive options is well, I don't think you've given an indication as to which one is the preferred option at the moment, but at the face of it, it would appear to my mind that taking things in-house with an investment in HR and building on the positives that you've seen in terms of culture change and what have you may be a longer term better economic strategy from a purely economic point of view than this more expensive option that at some point we'll have to bite the bullet and take it in-house unless we just accept that it's a some term, you know, whether it's Medigold or a different supplier, it's a long-term external contract.
Okay. So yeah, all sorts of bits in there which are fair questions. So I guess, why is it showing it over 3 years? Because it's just trying to be honest and realistic, people, about actually, is there a multi-year cost there? Why is it an expensive amount within an option 1? I mean, that's a market rate, I guess, for an organisation of our size, and that we've been out to market previously. Why does it not have too many specifics in there? Well, we're doing that game, aren't we, where we're trying to choose policy and procurement in a public environment, as tonight, where actually we've still got a supplier that we're trying to work with, and if we decide to go in a different direction, we still have to get the most value out of our contract for the next 6 months to go. You made a point about, if we went down an option 1 after another year, would we be left with having to fall into a cost of movement back? There would always be a cost of movement back, but there may be an option 5 available to us at that point, which is looking to go in a slightly different direction with our HR system and how that might work together. And you've said, would a longer term economic strategy be to spend just 40k and bring it back into HR? I mean, we've had the process in HR for a while. I guess Medigold really do give us that added value that as an organisation we would struggle to set up that level of complexity around call centres and IT systems, which our existing suppliers can't do. And that level of complexity to run a call centre, process-driven expertise around sickness recording, it would be ambitious to think as internally we could do that around the 40k mark. We might be able to manage it on 40k, but certainly the setting up of it is a significantly greater figure than that. So hopefully I've addressed 4 or 5 of the points there.
Yeah.
I think,
sorry, go on.
I think the last point you meant is, what's the recommendation? I think there is a line in there at the back of the report about discussions that are being held internally within the organisation by the corporate management team, and I guess they've been as challenging as you all have been tonight in the questions, and I think that their general feeling is that the process has been relatively well received and has worked very well on the frontline operatives of the organisation in order to manage sickness, and therefore, although they haven't got to a final decision, I think they're generally supportive of continuing on with the Medigold process for a period of time. Okay.
Thanks. Again, that's helpful. I guess the bit that doesn't sit easy with me, because I think option 4 is a 40k cost to transfer and migrate, and then a 25k ongoing cost, and talks about putting in place additional support for managers and what have you. I wouldn't expect that we'd provide a bells and whistles call center service and all of that sort of stuff, and I say, when this was originally put forward, it was that was all part of that culture change that needed to happen, and actually that we may not need that longer term. The problem is if we frame this in terms of saying that well, actually we could never deliver this level of service internally, but we're only going to do a 1-year or a 2-year extension, well, in 1 or 2 years' time, we're going to have this same conversation again that says, well, we can't bring it back in-house because we couldn't deliver that level of service. And it just seems to me that if you take that longer term view, embedding within the culture of an organization in a economically viable way is a longer term strategy. And I guess what worries me is that last sort of thing I said, what's to stop us having this conversation in a year's time or in 2 years' time that again says, well, we've got to go out to contract again externally because we can't deliver this internally because we haven't got the expertise because we didn't invest in it 2 years ago or whenever it was.
Ian, I'm just going to go back again about the time that's been spent in terms of the culture change, because I think it's shifted significantly, and it is going to be the COVID conversation. I think we would have been in a different position had that not happened. We were coming back with what it could look like going forward, and I think we could get to that in-house position in time. But if we did it very quickly at this stage, I think it would probably cost double, if not that double of the 40k, just in terms of trying to unpick quickly some of the good practice that's been put in place. Just a simple thing like somebody failing to report sickness absence and the significant amount of overpayments that or they don't do the right paperwork, for instance, and just some of the mechanics of getting people paid correctly. This has really helped to correct some of those bureaucratic nightmares. Not to say that putting more staff in will undo that, but that period of time that allows us to get it into better shape, I think, for bringing it back into house or whatever else that might look like, would mean that Medigold may not be the future for York. It may not be them in the future. It could be an in-house service, but COVID's just given us that bump that's meant that we've not been able to put the alternatives in that we talked about in when you were part of the process, October 19.
Yeah.
And Chair, I'd just say that I mentioned before that option 5 around the HR system.
Yeah.
If we think of Medigold as two split processes, one process driven data capture, the other side a call center, I'd really hope with a new HR system that had slightly additional functionality, whether it's a next generation version of our existing supplier or a new supplier, that actually that could be covered pretty much at cost within that contract. So it would just be the call center side of it. So I do think we have options a year down the line. I don't see this playing out the same way for the next umpteen years, hopefully.
Okay, thank you. So members, I guess, we are asked to consider the information within the report, give feedback, and any feedback will be provided to the executive for decision making. Is there anything that members particularly want to give us as feedback? We're not asked to make a recommendation or anything like that particularly, but are we happy that Ian and Claire sort of take the conversation that we've had and incorporate any of that into feedback, or is there anything specifically that we want to say? Looking around, I'm not seeing anybody kind of jumping up to wave a hand or anything, so I think I'll trust you, Ian and Claire, to sort of take a summary of what we've said, and I think we can leave it at that. And if the report comes to executive and anybody has any burning sort of injustice, then we've all got the option to register to speak, haven't we, if we wish to. So thank you very much for your time, both of you, this evening, and apologies again that you've had to wait up till this hour to come and speak to us, but it is much appreciated.
Thank you.
You're welcome to leave the virtual table.
Yeah, thank you, Chair. Thank you, committee.
Thanks all. And then everybody else, just the formality of saying that there is no urgent business to take at agenda item 7. So I will just apologise again to all of you for a 3-hour meeting when I really don't like anything over 2 hours, but such is life sometimes. So thank you to you all, and thank you to all the technical and support staff that are off screen as well. It just leaves me to say good evening to everyone.